IMPRI, Impact and Policy Research Institute, Prabhav Ivniti Anusandhan Sansthan, Nai Delhi. Extend my warmest welcome to you all to IMPRI, Web Policy Learning. Today, we are gathered here for day 4 of the Beyond Binaries Cohort 2.0 theme LGBTQIA plus narratives VR. This 1 month immersive online certificate training course will be a potent tool for engagement, persuasion, coalition building, and perception shaping within LGBTQIA rights and equality. It will render complex issues pertinent to the community comprehensible and relatable, facilitating engagement among policymakers and the broader public. An instrument in building coalition among diverse stakeholders, uniting queer individuals, allies, and advocacy groups behind a common cause and amplify collective voices in policy advocacy efforts. We welcome you to join us for an immersive journey that centers diverse queer narratives, mobilizes policymakers to challenge stereotypes, dismantle stigmas, and promote greater social acceptance and inclusion. The chair for the program is Professor Vibhuti Patelji, visiting distinguished professor, IMPRI. Our expert panel for the program includes Dr. Debolina Deji, Rituparna Neog ji, Dr. Aqsa Shaikh ji. The conveners for this course are Professor Vibhuti Patel ji, Dr. Sibi Mehta ji, Ms. Vithita Jha ji, Dr. Arjun Kumar ji. Proceeding further, we welcome everyone to this transformative journey and appreciate your dedication in investing your time, energy, and commitment to gaining a profound understanding of the crucial role and intricate details of pure inclusive policy rooted in equality, dignity, and justice principles. We have also shared course outline and reading resources in your Gmail for your kind perusal. Before we start today's session, I would like to state the housekeeping announcements. Please join the meeting on time. There will be a question and answer session after each presentation. Share your questions on the question and answer box. The questions must not be posted as an anonymous attendee. Ensure that your questions are precise. Refrain from making general comments in the question to save time. To begin today's session, I would like to invite our chair, Professor Vibhuti Patelji, visiting distinguished professor at IMPRI, to give her opening remarks. We welcome you, ma'am, and over to you.
Thank you, Ms. Ritika Pandey, for introducing the course. And I would like to, first of all, thank Dr. Arjun Kumar, Dr. Singh Mehta, and welcome Dr. Aqsa Sheikh for today's program. First of all, let us have a recap of what all has transpired over last previous 5 days. Day 1 began with a nuanced understanding of gender and sexuality, and Moulee was the first to begin that how LGBTQIA persons should be viewed as constituency of diverse groups coming together. And he also said that queer family members are in each and every community, contemporary politics, and also in Indian political history. Indian queer movement has a very decisive impact in the recent times. So we cannot be in a denial mode with regards to political constituency of queer community. He also talked about some of the defining moments in the history of the struggle of the queer community. Professor Prince Manvinder Singh Gohil ji, who spoke next, his speech was daring and encouraging in terms of the achievements that he had in the midst of painful personal experiences of growing up years in Rajpipla in a princely family. And he said that how he gained popular mandate from the queer community and the enlightened citizens, which enabled him to, first of all, establish Lakshya as an NGO and also expand its activity in collaboration with the government of Gujarat. And the first Garibak route that he established also provided example of the best practice. Third presentation by Ragamalika ji was on she began with the critiquing the Transgender Persons Protection of Rights 2000 2019 Act. And she says as a journalist in the mainstream field, she's also showed the insensitivity and the portrayal of peer community. And she said that it is very important to community in the media, because media shapes the people's mindset, and it is a very important to provide an alternative. And she shared her experiences of Queer Lit Fest and also the organization that she started for the uh, personal grounded reality of the queer community. Day two, we had Dr. Dhiren Borisa, who made a grounded presentation informed by intersectional perspective on queer cartographies of desires in Delhi, and he provided vivid portrayal of different spaces for the queer gatherings and the intersectionality, and also the how the homonationalism that processes the hegemonic power selectively agree with the claims of sexual minorities, and they exploit him to justify racism, xenophobia, and contempt towards the poor and minorities. And that's why he also introduced the International Lesbian, Gay, Bisexual, Trans, and Intersex Association. He spoke about the Keshav Suri travels and tribulations of Keshav Suri Foundation. He also discussed the question of very important political events with regard to the social movements which were encompassing the major concerns of queer community. He ended with the very powerful recitation of his poetry in Hindi. We also had a third presentation by Mr. Harish Nair, and where he talked about embracing equality and advancing LGBTQIA rights in professional landscape. He shared the experience of corporate world, and he says the best practices adopted by Godrej, it also created a pressure on the corporate world in terms of making DEI policies in practice, not only as a platitude, and gave examples of Lilac Insights, Axis Bank, IBM, Lalit Suri Hospitality, where Harishji also shared the Come As You Are charter of policies and practices of Axis Bank. The was marked by three presentations by Raj Mariwala-ji, Advocate Rohin Bhatt-ji, and Rituparna-ji. Raj Mariwala spoke about shift from being queer-friendly to queer-affirmative, and gave several examples of how being queer-friendly is not adequate. You need to be queer-affirmative. And he also discussed the mental health and its intersections with marginalized communities. Rajji also talked about the support helpline I call, which Mariwala Foundation sponsored at TISS. And several questions, because it was an interactive session, and the questions posed by Raj Mariwala-ji were answered by the participants. About the questions were about what do we mean by mental health, what kind of the most interesting part was a narration of a scenario of reverse reality where only same-sex relations are norm, but heterosexual persons have to be included. That made the participants sensitize about the alienation and anguish of LGBTQIA community. And he said the barbaric behavior against the queer community and some of the very, very objectionable methods like electroconvulsive therapy, conversion therapy, surgical intervention of intersex folks that need to be abhorred, and we need to be the public opinion where the medical fraternity learns to respond to the needs and aspirations of queer community. Raji also shared several websites where we can get more understanding of the issue. Advocate Rohin Bhatt, who spoke spoke next gave a vivid description where critical reflection of several legal battles in the Supreme Courts and various high courts that we had right from 2004 till the date, and stated that the Transgender Welfare Board at the state level have a the members have transphobia and Islamophobia. So we need to really work really hard to see to it that the genuine people represent such decision-making bodies. The last presentation was by Rituparna Boraji, who on the experience of the organization, their own organization, Nazaria. She spoke about the body image and self-worth and sexuality in media. That was also an interactive session in which important issues concerning whatever is portrayed in media were discussed, and she ended with the analysis of films, the film Princess Diaries and the Trolling of Prachi Nigam, a topper in 10th board exam from state of Uttar Pradesh. And she ended with an appeal that let us strive for a safe space marked by empathy and compassion and step down from our positions of power, and let us go together and provide social support to diverse people with diverse lifestyles. And we need to push the boundary. Day 4, now today, we are going to have equally interesting discussion by Dr. Aqsa, Shaikh, Rituparna Neog, and Dr. Debolina, all three extremely rooted, active, and very erudite in their presentation of the problem. Thank you very much.
Thank you, ma'am, for those enlightening remarks. Now, for our first session, I am delighted to invite Dr. Aqsa Shaikh ji, Associate Professor, Community Medicine, Hamdard Institute of Medical Sciences and Research, New Delhi. Dr. Aqsa Shaikh will guide us through the topic of trans-affirmative healthcare, disparities, interventions, and outcomes. We welcome you. The floor is all yours.
Hello and good afternoon, one and all. It's really my pleasure to be discussing about this important topic in one more very important session by IMPRI. I'm really privileged that I get called time and again for facilitating these sessions on the courses that IMPRI conducts. And it's my pleasure always to interact with the lovely participants and take the cause of trans-affirmative healthcare further. Today we'll be discussing with the basics, but I'm very happy, to know that so much of what I wanted to discuss has been already discussed by the esteemed speakers who preceded my talk, many of them being friends, especially the conversations that Raj Mariwala had. It seems that they have already covered a lot of important aspects, and therefore I think that will help in further understanding the nuance of trans-affirmative healthcare. And I really look forward to more interaction, more questions, remarks, and sharing of experiences from all of you. Since there is no expert over here, all of us are experts of our lives and our lived experiences, and it will be really great to learn something new from the participants today. I'll be using a few slides to take this conversation further. So let me just start sharing my screen. So today, while the slide says trans-affirmative healthcare, and our focus will be more on transgender persons, it would to some extent also apply to queer affirmative healthcare or LGBTQIA plus affirmative healthcare, with trans people representing only one alphabet in the LGBTQIA plus soup of alphabets. But we must also remember that gender identity is only one aspect of transness, and trans people also have a sexual orientation. So trans people may also be lesbian, gay, bisexual, asexual, queer, questioning. They may be also intersex. And therefore, in a way, the entire LGBTQIA plus spectrum also represents the trans people. Um, it was very heartening to know that there has been already conversation on why, just trans sensitive or trans friendly or trans inclusive is not enough. We now need to move on to trans affirmative healthcare, where the healthcare comes from the experiences of the trans persons and is not just a healthcare provided by cisgender people to transgender people, which tolerates their existence or which is friendly to them or which is acceptable or inclusive to them. But the healthcare comes from the experiences of trans affirmative trans people and their own narratives, and that is how it gets shaped. So that's the ideal that we are chasing here. Now, when we speak about transgender persons, this is of course a Western label that we use. In India, trans people have been existing for centuries, and they have been part of our culture. And we do have some local terms and names by which we refer to a lot of transgender people, like, for example, the Hijra community or the Kinnar community, Aravanis, Joktas, etc. They have been there for centuries or even more, and a part of our culture have been recognized. But the word that we now use universally is transgender persons. Now, in India, when we typically speak about a transgender person, the image that comes in front of our eyes is that of a Hijra or Kinnar person. And because that is how typically our perspective of a trans person is shaped for centuries. But I want all of you to also imagine and visualize when I speak about a transgender person to also include transgender men, who are often a minority within the minority of transgender people and are invisibilized in their existence. So remember that there are also transgender men. In addition, we also have non-binary folks who do not fall into the binary of transgender man or a transgender woman. You also have transgender persons who are gender non-conforming, who don't believe in the concept of this male-female gender, or who may be gender questioning, who may be gender queer, who may be gender fluid. So lots of terms there. But basically, when we talk about transgender people, we mean that those whose gender identity, whose sense of who they are in terms of their gender is different from the sex that was assigned to them on the basis of their biology or their anatomy. That denial or that rejection of the label or the gender which was imposed on the basis of sex or body is basically transness. And that's what the meaning also literally means. However, when we speak about transgender persons legally within the Indian context, since we have a legislation now for transgender persons in India, and I'm sure my friend Rohin must have spoken about it, we have a definition which says that a transgender person is someone whose gender identity is something which is different, which does not match with the gender assigned to them at birth. This can include transgender men. So transgender men are those whose gender identity is that of a man, but they were assigned female sex at birth. Trans women were those who were assigned male sex at birth, but then their identity is that of a woman. That is why we say trans woman, because the asserted identity is what we need to write. Irrespective of whether such people have undergone any procedure, a gender affirming procedure like sex reassignment surgery, hormone therapy, laser therapy, or any other such therapy, irrespective of that. So irrespective of what their body is, if they identify as someone who does not match that, then they're a transgender person. Now, interestingly, in the Indian legislation, they have also included intersex persons. Now, as we all know, intersex people are those in whose case, because of their anatomy, physiology, their biology, their sex chromosome, their hormones, or whatever, what we call as sex characteristics, you are not able to put them into either a male or a female category, the typical male-female sex that we generally talk of. And therefore, such persons are called persons with intersex variations. They were also called and are sometimes still called persons with DSD, that is disorders in sex development, but a better term to use is differences in sex development. It also includes genderqueer people and persons having sociocultural identities like Kinnar, Hijra, Aravani, and Jokta, Jogappa, etc. This is from the Transgender Persons Protection of Rights Act 2019 definition. I'm sure we also have had discussion which talked about the criticism of the Transgender Persons Act and how even this definition, which looks like quite broad, may be confabulating because it puts intersex people also in the transgender persons, or it does not take into consideration certain other gender identities which may be there. Like, for example, non-binary persons. Now, how many transgender people are there really in our country? And well, from the last census, we know that we have not had this round of census by the government, but the last census said that there were around 4.87 lakhs people who did not choose the male or female gender. They were put into the others gender category. We are assuming that this others gender category is that of the transgender persons. So if we extrapolate from that, then there are roughly 5 lakh trans people in India as per that census. Surprisingly, there were 54,000 of them were children, below 6 years of age also. So which means that probably they have confused between intersex persons and transgender persons. Nonetheless, this is what the rough figure we have. The community believes that this is an undercounting of the trans people and the actual number is much more, because a lot of trans people may not, tell a census enumerator that they are trans person, or they may have an ID which is in the binary of male or female, or they may be still wondering about it, questioning about it, trying to find out and navigate. Now, after the Transgender Act and the rules came, the government started issuing IDs to trans people, and they have been issued for the last few years. But as you can see, so far only 20,000 ID cards have been issued. So as per the government ID, if we see, and this is a very important aspect that we need to understand, because ID is the gateway to all the benefits that the government says it will give to the community, like scholarship, insurance, healthcare provisions, etc. And currently only 20,000 people have been issued this ID card, which is roughly 4% of the counted population as per census. This means that 96% of the population of trans people has either not applied for the card or has no access to the card, and therefore are not eligible for the services by the government. And this is an important thing to understand as we navigate further. Now, when it comes to trans people, we know that in India, we have a right to education. And under that right to education, even trans people have a right to education. But then just giving a right to a community does not mean that they're able to access that service. There's so many barriers for trans people. When I say trans people in schools, I'm talking about young children and adolescents who have either just realized their identity or maybe still, navigating it, exploring it. And for such persons then to be in a school where they do not have an acceptable environment, where they may be teased, bullied, harassed, also not accepted by family, teachers do not have an understanding, then pursuing the education becomes very difficult. Unfortunately, in our Indian context, there is no teachers training on trans sensitivity. A manual was launched by NCERT on teacher sensitization, but then following opposition by some of the people from our civil society, that manual was taken down from NCERT website. And you'll not be surprised, I think, to know that the objection was raised by National Commission for Protection of Child Rights. So, the people who are supposed to protect the rights of trans children were the ones who also opposed this manual. So there's no teacher sensitization. Also, there is no policy or law to stop bullying in the schools. Remember that bullying is done by children of other children. And in India, we do not have a law that penalizes bullying or that holds the system accountable for bullying. And we have had instances where queer folks or trans children have lost their lives because of the bullying in the school and lack of adequate policy measures or actions taken by the school. The DPS Faridabad case being one such case of our way in the picture. So in the trans community, often, there's lack of education. Many of the trans children run away from their homes or leave their homes in their adolescence. And therefore, the education is not available. We know that today, even those people who have good amount of education find it difficult to get employed. So when you're a trans person and then you don't even have education, the employment opportunities are really very shrunken for you. Now, we need to understand that trans people are still there. They're surviving. They're earning also. So how do they do that if they are not in the mainstream professions? So there are, as you know, it's a cultural community. It has a cultural background. So badhai, or what we typically call as begging in our language, is what is practiced. And that is often the idea that we have of a lot of trans people when we see them at the traffic signals. In addition, since there's demand, there also is a supply, and that is in the form of sex work by the trans people, especially trans women. And then you also have performances or providing blessings on happy occasions like the birth of a child or a new house or something, and then people give them money for that. Now, for centuries, trans people have not been recognized. In fact, they have been criminalized, as you know, under the Criminal Rights Act, which was taken down. And the trans people did not have equal rights as men and women. Our constitution also spoke about men and women only. The law spoke about men and women. But what about trans people? And it happened for the first time only 10 years back, when the NALSA versus the Union of India judgment was given by Supreme Court in 2014. And that was the time when, for the first time, India recognized a gender beyond men and women and talked about the existence of transgender persons. And this was a very landmark judgment that came. It was way ahead of its time. And it said that not just trans people should not be discriminated against, but they should also be provided equal opportunity in education, employment, healthcare services, reservations also in the jobs, etc. And that's how, that was the stepping stone for a lot of things that followed later. And this is a brief, I wouldn't say very exhaustive, but an indicative timeline of some events that have been happening in the last 10 years. And I would say we have progressed quite a bit in the last 10 years in terms of transgender rights. This progress may be, in fact, more for trans community as compared to the LGBTQIA plus community or LGB community specifically. So in 2014, as I mentioned, we had the NALSA judgment come up, which legally recognized trans people. In 2018, the Indian Psychiatric Society gave out a position statement saying that being gay or being trans is not a mental illness. No attempt should be made to treat them, and convergent therapy should not be there. And this position statement was also helpful in reading down the section 377 of IPC, the section that criminalized homosexual acts, even between consenting adults. And we now know that the IPC 377 has been read down. It's no longer a crime to be having consensual acts between two adults. Something to ponder upon is that what happens after 1st of July when the new penal codes come in and IPC 377 itself goes away, because right now 377 criminalizes forced sex on men, which probably will go away after 1st of July if the Bharatiya Nyaya Sanhita comes into picture. Anyways, so in 2019, the Transgender Persons Protection of Rights Act was passed by our parliament. It wasn't a perfect act, but I would say it did provide something. 2020, the rules came. In 2021, The conversion therapy was banned by the order of the Madras High Court, and then the National Medical Commission also gave out an order. But then it's a court order, so it does not have the same thing as an act, and we don't have an act for conversion therapy or which penalizes conversion therapy. The National Medical Commission only calls it a professional misconduct, which means you may lose your degree, but you don't go to jail for practicing conversion therapy. In 22, the government launched the special health insurance called Ayushman Bharat TG Plus card. Again, in 22, the MTP Act was read to also include trans people within the definition of women who avail MTP. 23, NHRC gave out an advisory on transgender people, that is National Human Rights Commission. 23, again, the Supreme Court, in its marriage equality case, while it did not give marriage equality to gay people, it did assert that transgender people have a right to get legally married within their personal laws as well as in the Special Marriage Act in the heterosexual relationships only. And in 24, we have at least 2 high courts, West Bengal and also the Madras High Court, talk about giving reservation to transgender people. Please understand that right now we do not have a central provision of reservation for transgender people, but some states have been trying it out, like for example in Karnataka.
Some connection issue. You can hear us, Vibhuti ma'am?
No,
Ah,
I
okay.
can hear you. Yes.
Yes, I think it got stuck. I'll just contact Aqsa. It has dropped. We'll wait for her to learn.
Yeah.
It's also raining here in Delhi today, so
Yeah. In Delhi also it's raining.
uh, all black today. Clouds.
Oh. Probably it has become cloudy now, but
Ma'am, for 3 months now, it will be like that.
she's joining.
Yes.
Ah. Has she joined?
No, I'll just.
Yes. Hello, Dr. Aqsa. Yes.
Sorry, my Wi-Fi just got disconnected. I'll start sharing the screen.
Yeah.
Yes. So, as I was mentioning, the state courts, the high courts have a very important role in pointing out the queerphobia and the transphobia within the medical education and directing the National Medical Commission to bring about the changes. And subsequently, then National Medical Commission revised the MBBS curriculum, at least in 2 subjects of psychiatry and forensic medicine, and removed certain derogatory terms and introduced certain skills that the doctors should have. It also passed an order which mentioned that if someone practices convergent therapy, now what is convergent therapy? I hope that discussion has already happened, but just to reiterate, in medical terms, it is basically any form of procedure, therapy, counseling, medical, hormonal, surgical that is being done to try and change the sexual orientation or the gender identity of a person against their will. And this is an important clause to understand. So it said that conversion therapy will be a misconduct and there will be a professional consequence of it. Did this order have any effect? We don't know of even a single person who has lost their degree or has been penalized against this act. It's important to understand that the act is only for MBBS doctors. It does not apply to Ayush doctors who may be practicing conversion therapy. It does not apply to any Babas, etc., who practice conversion therapy rampantly in India. And there is no penal provision to fine or have a jail term for people who may be practicing conversion therapy. Then we have the National Human Rights Commission, which took up the issue and issued an advisory. And some of the health-related aspects are those which I want to highlight. So it said that there should be development of medical boards at every district level for providing counseling and consultation for sex reassignment surgery. The act says that every state should have one hospital providing sex reassignment surgery, but the NHRC went further and said every district should have counseling services. And it also talked about, some kind of insurance, etc., for covering the costs of the surgeries. As I was mentioning, the Ayushman Bharat TG Plus card was an add-on thing that the government added to its, flagship health insurance of Ayushman Bharat, which said that all trans people, irrespective of their socioeconomic status, would be provided a healthcare coverage of 5 lakh rupees, in which they can also get procedures done like sex reassignment surgery. Unfortunately, though the scheme was launched 1.5 years back, it has not been rolled out yet. So we do not have trans people who have been able to avail any benefits under it. Similarly, the government has also initiated a Center of Excellence for Transgender Medicine at AIIMS, New Delhi. It has just started functioning. A few surgeries are being performed there, but there's a critique that I have done on why we don't need centers of excellence, but we basically need that everywhere in the primary healthcare system, the transgender person should be able to provide. So I'll share that article from Indian Express also with all of you later. And when it comes to trans people's healthcare, do we have any guidelines or standards of care given? So there's something called as WPATH. WPATH is World Professional Association for Transgender Healthcare. It has members who are plastic surgeons, endocrinologists, gynecologists, etc. And they have together framed certain standards of providing care to trans people. I mean, despite of what we see as a lot of progressive legislation, etc., we need to understand that, science is still struggling. So we have some systemic discrimination being done against trans people. And if you look at the blood donation guidelines in India, it says that if you're a trans person, irrespective of anything else, you can't donate blood. As if, being a trans person itself means that you have a higher risk of having HIV, which is wrong because it does not take into consideration that not all trans people would be at a higher risk of HIV. Similarly, you have guidelines like in sports, where trans people are not allowed to participate in the women's sports categories, for example. So there are still many laws or policies which systematically keep trans people out from certain sections of our life. Now, as we were talking about trans affirmative healthcare, let's focus more on, healthcare of trans people. And I often say this, that, we say that trans people are same as everyone else. We are all equal. There's nothing called as equality. We talk about equity often. And trans people are not equal to cisgender people. I mean, their healthcare needs are not equal. In fact, trans people have a higher, in general, on an average, healthcare needs as compared to cisgender community. And there are certain reasons why I say so. It may sound like a bit controversial statement, but it's a fact that the risk of mental illness or mental ill health is much higher in trans community as compared to cisgender community. And it is not because of their genetic makeup or anything. It is because of the environmental factors. It's because of the stress that just being a trans person has. Many of you must have heard about the minority stress model, on how simply being a part of a minority community can put you in a stressful, discriminatory situation. And therefore, when it comes to trans people, because of lack of acceptance in the society, because of lack of acceptance by their own family members, teachers, friends, etc., you'll often see that the risk or the burden of mental illnesses is much higher, which can often exhibit in the form of disorders like depression, anxiety, and so on. We also see that because of these hopeless conditions around us, the risk of suicidal ideation and attempt is much higher. Often trans people resort to the use of harmful substances to cope up with their stressful lives, and therefore the use of harmful substance can also be much higher. Many trans people, because they don't have access to endocrinologists, may do self-medication with hormone therapy, and therefore may have risks associated with that. Since trans men and non-binary people do not have access to menstrual treatment, menstrual disorder treatment in the same gynecology OPD where women have access, the amount of unmet need for menstrual disorders treatment is much higher. They often suffer silently rather than visiting a gynecologist. Then, because of the traditional profession of sex work, and also because of lack of preventive services being made available, trans people often have an increased risk of STI, including that of HIV. In fact, it was the HIV pandemic which, for the first time, brought the focus on health of transgender persons in India around 30 years back. Then we have, of course, the increased risk of NCDs, non-communicable diseases and cancers. Often we talk about only communicable disease or HIV in trans people, but we need to look at the risk of NCDs and cancers. And I specifically talk about cancers because, the preventive aspects of cancers are not taken into consideration. Then you have, of course, the added burden or need of gender affirmation services, which need medical services, counseling services, surgical services. And all this comes in a lack of, access to preventive healthcare, lack of family and friend support, poor insurance coverage, poor awareness, affordability, access, etc. So when you have more demand in your body, in your mind of healthcare services, at the same time, you're not able to access, or the system does not provide those services. And while we typically, when we speak about trans people's health, we look at HIV, we look at sex change surgeries, etc. We need to understand that all trans people have a need of general healthcare, right? We also get fever, diarrhea, etc. We also need services for that. In addition, you need services for gender affirmation, for sexually transmitted infections, HIV, the burden of which is much higher, sexual and reproductive health also, including menstrual disorders, tuberculosis and other communicable diseases, non-communicable diseases like cancers, and also mental health care services. So these are, just a broad spectrum of the various services that a trans person may need during the course of their life. But, accessing these services is often difficult. And to explain that, we look at the socio-ecological model. So the socio-ecological model says that when we look at the access to these services, some of the factors may be at the individual level. There may be factors for me as a trans person individual because of which I'm not able to access those. There may be reasons in my family, in my society, in my community, interpersonal. Then at the organizational, hospital, healthcare level, at the community level, and also at the public policy level. So just to highlight a few, when it comes to barriers that trans people may have within self or family, there may be some self-stigma. I feel that if I'm bad, or I'm inferior, or I feel that I will be discriminated against, and therefore I don't go out and seek service at all. I may have body image issues. And I've used this picture of a trans man who has had a chest reconstruction surgery after the removal of the breast. Now imagine if this person goes for an ECG to a doctor. The entire focus shifts onto these scars on the chest rather than on the heart disease of the person. And therefore, a person may prefer not to go and get checked at all, or may not want to be undressed in front of a unsensitized healthcare provider. People may have past negative experiences and they may think the experience will repeat, or their friends may have had an experience and they think the same will happen to them. And because of all these things, they are not able to seek services. Also, who decides that I can seek a service? If I want to, if as an adolescent, if as a young person, I want to go and seek a psychiatrist's consultation, is it my only individual choice, or do I have to ask my parents? Do I have to ask my guru? Do I have to take leave from my workplace? How do I explain it to my boss? So many factors which are there because of which we are not able to visit and take healthcare services. And then there are barriers also at the healthcare system level. There is services not available. Now imagine, are there trans-friendly even doctors available? Are they accessible to me? Are they affordable to me? Is they providing a quality service? Right? Are they sensitized? Just knowing a skill of operating is not enough. You need to be also be sensitized. Do they even have competence? Many trans people have lost their lives on the operation tables because of the incompetent surgeons and anesthetists. Are there any SOPs, standards of care that are there in India? So remember that in India, we don't have a legal standard of care or which is given out by any professional body also. We only have the WPATH guidelines, which do not have a legal mandate in India. A doctor may say, I was not legally bound to use them, right? And therefore, for medical negligence cases, it will be difficult to try. So one is there are barriers within me, within my community, and then also at the healthcare and the policy level. Similarly, certain, legal barriers also there, like blood donation guidelines, which I mentioned. Trans people are systematically not allowed to undergo surrogacy or assisted reproductive techniques. They are removed from that. You also have sex normalizing surgeries. I think that's been already discussed by Raj on surgeries on intersex children. But there is still hope, I would say. And I would also say this, that there's something that we can do, and we must really try and do that. One very important thing and one very important lesson we learned is that the laws need to change. We got rid of the Criminal Tribes Act, we got rid of Section 377, we had the NALSA judgment, the Trans Act come. But then there is more that needs to be done. The case against the blood donation guideline is in the court. The case for intersex surgeries not being done on children is in the court. And we need to fight them and ensure that we get legal rights for them. We also need to understand that there is healthcare for all, right? Health for all should be there. And in that, all trans people also need to be included at all levels. We are not only looking at AIMS Delhi, but at a PHC, if I'm going, then am I getting the equitable service there? And therefore, also important focus has to be on essential healthcare and mental health care. We have to look at changes in the medical education and the healthcare system, so that the new set of doctors who come in are trained in providing competent healthcare to trans people, which is also sensitive. And for that, we need changes in the healthcare policy. We need changes in the curriculum to happen. And lastly, while we do all this, one important thing to understand is the adage that we also use in disability rights, that nothing about us without us. Any decision, any policy decision that's taken about trans people must include trans people on the table and must include the right kind of trans people. I think Rohin had pointed out that the national commission, which is there, council, which is there for trans persons, has certain people who are not trans and who are rather transphobic and even Islamophobic. So when we speak about nothing about us without us, we have to also see who are these us who are representing in the policy decision making. With that, I'll stop here and look forward to questions and interaction.
Thank you, Dr. Aqsa Shaikh ji, for providing such a comprehensive and enlightening session. Now, I would like to invite our chair, Professor Vibhuti Patel ji, for remarks on the session.
I think Dr. Aqsa Shaikh, you have expanded the horizons of our understanding on queer people's life, right? Because today they discuss the problems, but you have also focused on the alternatives that medical science, in medical science that we need to aim at, because your suggestion of changes in the curriculum, making it gender responsive, and also the transit is very important. Some of the laws which are expanding the scope and the inclusion community in which you have brought in as a medical professional. I think I would also request you to tell us about your your initiative, which you have started as a WhatsApp group, no, for the medicos and anyone who is interested in the healthcare of the queer community. I think that would be very useful for the participants because many of them are active in the movement. My question to you is about this Nyaya Samhita, in which if 377 goes, then if the queer, if the there is a same-sex sexual coercion takes place, do they approach IP means 376, the law on sexual violence? What would be the recourse for them? Because such incident happened in TISS where I was working. No, the young boy, means young queer person, was raped by another person, celebrity person who came as a guest.
Thank you, Professor Vibhuti. So first of all, talking about the initiative that we have for making the healthcare system more inclusive. So I work with Sangat India, and we have an initiative called Initiative for Health Equity, Advocacy and Research. And through that, we work with marginalized communities, especially trans, queer persons and persons with disability, trying to see how we can make the healthcare system more inclusive for all. And we do research as well as sensitization and advocacy work. That research is focusing on how trans people face barriers in accessing healthcare, especially our work on COVID-19 vaccination access. We have been also working towards making the curricula inclusive for trans people. And we have been conducting workshops across medical colleges with medical educators and doctors on how they can have those skills to care for a trans client when they see one. This is a lot of work in progress. I would request the participants to check out the I Hear section on the Sangat website. If you just Google I Hear, it is IHEAR, then you'll be able to see. I'll also share the link. Coming to the law aspect, I mean, that is something very sad that right now we till 30th of June, we have section 377 of IPC still active, which means that while consensual sex is not criminalized, something which is forced is criminalized under the IPC. And therefore, any form of sexual assault against men would be also punishable under it, up to a punishment of 10 years. But once that goes, once from 1st July, as the plan is there, that the three things are going to replace it, then there is no provision legally for trying out anyone under sexual assault of men. So the 375 and 376, which deal with rape and its punishment, clearly mention that it's only against women. While trans women are included under it, anyone who is identifying as a man or has a legal ID as a man cannot be saying that they got raped. So that is one of the protests that the community is having, that it should have been retained, so that if someone is having a sexual assault against a man or a non-binary person, then there should be some provision to try that. Let's see what happens, and I hope that there will be some injunctions, there will be some court cases, and things will change.
Questions?
Thank you, ma'am. With that, Now we open the floor to questions from participants. Participants can either raise their hand or type in the chat box or question and answer box. We have question form from Girisha Kamboj. Girisha, would you like to
Yeah,
continue
so
with
I
the
read the
question?
questions. Should I straight away answer it?
Yeah.
Yeah. So the question about sports and trans people, I mean, that is something which will need a lot of explanation, but then just to talk about it briefly, the thing is that it talks about the human bodies, you know, this body structure, the bone mass, height, etc., the testosterone levels, and how they affect the sport performances. And therefore, they say that trans women, that means those who are born as a man and now are participating in women's sports, it is unfair advantage towards them. Though there is research which shows that trans women who have undergone transition and or who are on hormone replacement therapy for a sufficient period of time, their cardiovascular health and their bone mass health is equivalent to that of cis women. And they therefore don't have any unfair advantage. But unfortunately, I would say the jury is still out on that, and some of the sports have systematically banned trans women from participating, like for example in rugby, in swimming, in cricket also. We need more research, more evidence on this. And also, it's not only about trans people, it's also about intersex people. So we have seen in India also how some of the intersex athletes who had won, their medals were taken away from them when it was discovered that they were intersex, but participated in women's sports. So this is a human rights issue, which also has, which needs the help of science to secure those human rights. I think then there was another question which talked about the criminal justice system and especially the prisons and trans people. Well, we need to understand that while, the government wants that there should be separate wards for trans people in the prisons, most of the jails don't have it. Some of the jails have just started it. And often trans people are trans women are allowed to be in the women's wards. We are against a separate ward for trans people by force, because then it becomes like a solitary confinement for them, which is not at all healthy for a prisoner. Also, the Home Ministry came out with a list of guidelines that if a trans person is there in the jail, then how their medical examination, frisking, and their, what kind of clothes should they be allowed, what would be their legal ID and all that. So there's a set of guidelines by Home Ministry on that. But, when we spoke with a lot of jail authorities, most of them were not even aware that Home Ministry has issued such a guidelines. So we need definite changes in the prison manual and also actual provisions of infrastructure. Just giving it on paper is not enough.
Thank you, Dr. Aqsa Shaikh ji, for your inspiring and engaging talk with us. We hope to see you in further IMPRI events as well. Moving on to our next session.
Ritika,
I'm honored to.
Shinoyji has also raised hand. Shinoyji, do you want to ask your question? Shinoy,
Thank you so much. I just want to start by saying that, Dr. Aqsa and Rituparna, one of the main reasons I actually signed up for the course. Like, as a trans person, you are some of my personal heroes, and I really appreciate the work you do for the community day in and day out. And I think it's not said enough, like there's so much to be talked about. And one thing I really admired, Dr. Aqsa, in your presentation was the addressal of the culture around healthcare. While growing up, my father told me that there's only one noble profession in the world, in India, and that's being a doctor. But I feel it's reached this point where, uh, we've just continued to treat diseases and not patients to the point where we don't understand the person's needs. You know, just yesterday, I went to see a physiotherapist regarding spinal issues because as a trans man, like wearing a binder has really affected my back. And also, not wanting to wear certain garments has rendered my back kind of really weak because of constant hunching. And when I told the person that, I'm not comfortable wanting to correct my posture just yet till I do top surgery, the person's like, nay, nay, all of this is in your head. You need perfect posture first. There, all of that can be seen later. And like that inability to wanting to understand only is not there. You know, we've kind of associated all human bodies with this one ideal. For example, even the sports question which was asked, um, we see a lot of cisgendered people being banned from sports because we have assumed that women need to have a certain level of testosterone or men need to have a certain level of estrogen. And you know it's not just trans people who are affected by these harmful ideals. Cis people are also kind of not being allowed to participate in things. And so, like, my question, I think where I'm getting at is that where do we see, like, how do we create that mindset shift where we're not thinking about, okay, this person is walking in with this form of pain and we need to find this one solution for that pain, to, okay, this person has that pain, but they have certain barriers around which they cannot fix it just yet. And how can we create a space for that person to get, the right healthcare they need despite those barriers? And I think, we, for trans people, it's always, oh, surgery, oh, gender affirmation surgery. We don't, something as simple as going to get your cold checked is also like a hassle, because then that person will ask 1 million questions about why do you look like this? Why do you look like that? And God forbid you're even obese like me. And then that becomes 5 times more harder. And like eh, that mindset shift is what I'm trying to see. Like, we can create policy, we can talk about syllabus, but how do we create that space, for trans people and healthcare?
Thanks, Shinoy, for so honestly sharing your experience and your vulnerable experience rather with a healthcare provider. And as someone who entered the medical school in the year 2000, that's almost 25 years back, I had a terrible time, and over the years, I really got very hopeless with our medical system with reference to providing compassionate care to trans people. Since last 5 years, we have been trying to work with the healthcare providers and trying to create a trans affirmative healthcare system. And what really gives me hope, in spite of all these not so good experiences, are the young medicos, the young generation, which is right now in the first few years of their medical schools. I see a lot of understanding and inclusivity from their side. I also noticed that the our predecessors and mostly our medicos, etc., who have passed out, have never interacted with a out and proud trans person. They don't have those experiences, and therefore their perspective relies on what they imagine trans people are, or what they have been taught in the textbooks, which often criminalize trans people. And therefore, one of the initiatives that we have done is to look at the life stories of or experiences and first-person narratives of trans people and queer people when they went to a healthcare professional and how they were treated. And then taking them to the healthcare providers and saying, see, this is a real life experience of a queer person in the healthcare system. And is it okay? How can we make it better? I think stories are very powerful. As you'll also hear from Rituparna, who is our next speaker, and how, these stories can really bring about empathy or some kind of a change where just rules and laws and curriculum can't bring that enough. So I'm hopeful that things will change, and stories like the one that you shared are really powerful tools in bringing about that change.
Shreya Pandey has raised her hand.
Thank you so much. Uh, good afternoon. Thank you, Dr. Aqsa, for this very, very immensely articulate and such an informative presentation. It gave me goosebumps because I had never imagined about this. I never thought of this actually. So makes me feel very, very guilty as well. Uh, I would actually like to ask you about what happens when there is denial of healthcare. It is very, very obvious that these medical places, these spaces have become fortresses. This seems to be a forbidden border, a forbidden line for the LGBTQIA plus community. So, how do people deal with it when they're denied access to healthcare? And what if they are not treated properly? What is the recourse that they can really take? Do they really does the redressal of their grievances really take place, um, or this just goes into oblivion? This is such a serious issue, which seems to put them in a corner actually. So could you elaborate on this?
That would need another half an hour probably, but thank you, Shreya, for asking that question. We need to understand that trans people especially, have been always fancy for medical practitioners in the sense that the bodies have been exotic. And since at least last 50 years, a lot of experimental surgeries have been done on trans bodies. And that is why, as Shinoy mentioned, once a trans person goes for anything like even a cold or a fever, the curiosity of the medical practitioner is towards their bodies, which sometimes does more damage to the patient than the actual disease they came seeking a recourse for. Unfortunately, lack of regulation, lack of legal framework, etc., ensured that most of these medical practitioners went scot-free in spite of committing so many experiments on trans bodies. And that continues even till today. You talked about negligences and recourse. There have been many deaths of trans people which happened during or immediately after the surgery. Those cases are in the court, but in most of the cases, we see that the doctors are not punished or not taken into, the task. There are currently no guidelines. And even for other services, like for example, you go to a psychiatrist for, let's say, gender dysphoria, and then you get a lot of moral lessons from them, or suppose you're a person who is a substance user and goes to a psychiatrist, and then you get moral lessons from them. Are there any recourse? Well, our medical councils are extremely weak and inadequate in their functioning to provide any kind of those recourse. And that is why a lot of trans people do self-medication or go to unlicensed medical practitioners who may be better than some of the qualified ones in terms of their communication, or they just suffer. And that is why I'm very sorry to share this fact that trans people's life expectancy sometimes can be as low as a decade as compared to cisgender people. So yes, I mean, the current scenario is not very promising, but then I'm hopeful that, with the efforts of ours and all of you after this workshop, we'll have a better healthcare system.
Are there any more questions from the participants?
Shreya Pandey.
Ma'am, just
Yeah,
a
sure.
quick question.
I
Yes, yes, yes.
question. Yeah. So especially when it comes to trans men and gynecologists' role, I would say that things have become better in the last few years. We now have guidelines by FOXI, which is Federation of Obstetricians and Gynecological Societies of India, on providing services to trans men. And also we need to understand that trans men are an important client also for a lot of gynecologists who perform surgeries like hysterectomy, oophorectomy on trans clients. And therefore, many gynecologists have now started learning, have now started becoming sensitive. You know, they may still have their biases, but at least in providing services, they have been sensitive. So we now are seeing changes in the attitudes of the gynecologists towards the trans people, especially in the private sector. But when it comes to a public sector, and this is where the onus lies, you know, because not everyone can afford a private gynecologist. That you, if for example, a man, someone who has an ID as a man, can they go and get a gynecology OPD paper itself? You know, that itself becomes a barrier. Can they sit in the waiting room of a gynae OPD along with hundreds of women? Once they enter a room, will it be a shocking and a surprising thing for a gynecologist? So a lot needs to change in the public healthcare system. And even if a trans man goes to a PHC level, you know, they should be able to get that service. So while in the private sector, we see some changes happening, I think a lot needs to change in the public healthcare system and also in the gynecology education in the postgraduate curriculum.
There has been one more question from Shreya Pandeji about what about the rural-urban divide?
Well, when it comes to healthcare systems, I mean, we know that for rural folks, a lot of healthcare systems are not accessible. And especially gender affirmation services are super specialization. You know, you need plastic surgeons, endocrinologists, you know, just specialists, they're super specialists. So they're not even available in the rural areas, and very few who are providing these services, even in the urban areas. Like, for example, in entire country, if you see how many hospitals, government hospitals are providing this service, the answer is hardly one or two. In entire North India, you don't have a single hospital which provides this service. It's only AIMS, it just started right now. So, you know, things even in the urban areas are not that rosy, but in rural areas, those services are just not available. So yes, that divide is very much there. But then thanks to online services, at least some of the services are available online, and a lot of rural folks now seek, for example, endocrinology or psychiatry consultation online.
Any more questions from the participants? So moving forward, thank you, Dr. Aqsa Sheikhji, for your inspiring and engaging talk with us. We hope to see you in further IMPRI events as well. Moving on to our next session, I am honored to invite Rituparna Neog ji, queer rights activist, founder and director, Akram Foundation, queer intersectional feminist, storyteller. Rituparna Neog ji will guide us through the topic of rural queer realities, building community and advocacy in India.
Professor Vibhuti Patel, are you saying something?
Yeah.
I'm just sitting in a chair. No.
Yeah. Okay. Yes. Can you see me?
Yes. Yeah, I see you.
Yeah. Welcome.
Thank you. So can I start?
Yes, please go ahead.
Okay. Thank you. Thank you so much, IMPRI, for the invitation. And just though I was listening to the last bit of Dr. Aqsa, it was really inspiring, as I personally look up to Dr. Aqsa Shaikh as one of our translator and who has been immensely contributing to the transgender rights area in India. So yeah, and I saw one question in the last about that rural and urban divide when you talk about healthcare. Yes, probably I was also I had also planned to cover that things little bit like that rural reality. Since little bit of time already is suppressed, I also have another meeting, so I will try to be really short and we'll take more questions for sure. So I will talk more from my experience and the kind of work where I am engaged and where I come from. So I come from Assam. So हम यहाँ पे हमेशा बोलते हैं दिल्ली बहुत दूर. So and in that sense, for us, Delhi बहुत दूर, and then that Delhi is metaphorically Delhi for anything about resources, and looking into the life and aspiring. Many times, a lot of discourse, a lot of conversation also reach to us here very, very late. And we're like, oh, already something is happening in there, and then we don't know here. For example, when Dr. Shaikh was mentioning about super specialty, or doctor is not available in rural area. Forget about rural area. Even in Guwahati, we do not have a good endo, and then just maybe one is there, and everyone is just trying to go there, and that also not a specialist one. So these are some of the reality, and Guwahati being the biggest city of Northeast. So these are some of the reality in medical colleges. Even in the psychiatry department, people really doesn't know about it. Then how we think about healthcare in small towns where just there is just one civil hospital. So and doctors are already overburdened also. So these are some of the reality when we talks about people from a rural area or the queer folks from rural area. So for the longest time, we have always talked about very organically for sure. I always say this is organically that queer lives in urban spaces or city spaces. Because being in city spaces or urban spaces, it gives us more space to be there or to reclaim spaces or just to organize or just to get mobilized and just to raise voice for ourselves. For example, when I was growing up and for my college, I was in Guwahati. That time, during graduation too, I did not get much space even in Guwahati also. But when I was doing my master's, somehow I was connected to other groups or collectives. And then this is how I saw that we have one space. I'm now trying to little bit explaining from my personal experience and moving into the movement building practice or what the kind of work we are doing. And that time I saw that with some of the people who are coming from different parts or some of the local people of the city, we used to come together into small groups, and from there we probably try to organize something or just to aspire about equality or equal rights for us. I'm just saying aspire about, not even taking action or not even strategizing something or not even doing something also, just aspiring or wondering. A lot of time I say wondering. We used to wonder a lot when we used to sit in groups of 5 or 10 people in space like Guwahati. So, and I come from a very, very rural area. And coming from a rural area, I know that there are so many other queer people who are still living in the rural area. Because the people whom I met during my childhood, during my adolescence, and I know them that they are queer and they do not want to migrate to a city space or just to live their life. Because a lot of time with us queer folks, uh, we have this again aspiration, I will say, moving to a bigger city because bigger city probably give us more space. So a lot of people try to go for education, or if not, then for some other work. And so this whole migration of queer people from rural area to the bigger city is one of the common phenomena. Even be it traditionally people who were living in Tharanas and all, so they also find more spaces in bigger city because it gives you more spaces to earn your livelihood, or maybe the anonymity also help you. These are some of the context which is very much connected why one queer person wants to live in a bigger city. So, but then I used to think again and again, what about my those friends or the people whom I know who are still living in rural area and they do not want to migrate to urban area. Uh, and what should we do? And that time I used to always say that our movement has to go beyond. And when I say beyond, there is always some, brackets. So beyond means from the urban spaces, from the cafe spaces, from maybe some, discussion in drawing room or some cafe. From there, how we can take it forward. When I talk about from here, from the Northeast, Guwahati was one of the space where we can talk, but from the other spaces there was zero, probably very nearly to zero. Only some of the spaces where we could see some of the voice or some of the conversation that was very much limited to HIV intervention, TI intervention, and all these things. Maybe through the healthcare system around HIV intervention, you can talk a little bit about it, or maybe there was a little bit of acknowledgement about your identity. But again, we understand that layered problematic things also happen in those spaces. So from there, my whole work started and my whole learning with my community also started. As I always say that my journey of learning with my community. Because as a movement building practitioner, I strongly believe that my community is my university. Do I come from an university? I studied and then after that, but my university days are continuing where all my community people are my professors. They teach me on an everyday basis. Our community peoples, our lives, that lived experiences is our theory. Because we do not have again theory also. Yesterday, I was having a conversation with one of the faculty member in a central university, and they're a queer person, and they were very frustrated because one of their research scholar, uh, she comes from a multidisciplinary school, and then she is doing a research on transitioned body. So there are not really research on transitioned body. So she wants to do on that, and I was also involved with her in some literature and all these things. So most of the science faculty who were part of the whole committees and all, they were dismissing because there is no data. And they are saying, bring the data, bring the numbers, and you just cannot bring literature. You have to bring data. And then the other faculty was furious, and they were saying, are we just simply data? Are we just simply number? What about our stories? So these are very much reality when we talk about it. And this is why I always say that my community is my university, and then our lived experiences is our theory. And from there, how we can go ahead. So when I go and I see a young feminine person living in a village in rural Assam, very remote, maybe a border of Arunachal and Assam, and unimaginably, uh, rural, and I see that the person who has long hair, and then in the weaving area, they are finding solace with other women from the village, the cis women from the village. And maybe that person do not even have the articulation about what identity they confront to or they belong to. Or maybe in another space or another village, I met another person who is a female assigned person, and who knows that from a very young age they are in love with women, and then they do not have an articulation who they are. Forget about claiming about rights and all. And I have seen people living there, coping with the village system and going forward, and still not knowing that you have this identity and you belong to this, and you have this sort of rights for you. And that's the level of awareness what we see when we talk about living in rural area. At times in rural area, you are so lonely that you don't even know that there are some other people like you who are living and exist. Because once I was in a village in Majuli, that's River Island, uh, and then one of the person I met, and I was just having a candid conversation, and they said, "Ki, they like most of the people call me Baba, means Didi in Assamese. So, but is there any other people like me also? Do they exist also?" And then you know what kind of conversation you will have after that, and then what you do with that person, how you I know go near to that person more and more. Is our movement leaving behind some people, and we just do not talk about it? Because in a lot of time in the metropolitan cities, in university spaces, or in some fancy spaces, we see that we are busy with some small things, and then but there are questions about someone's survival or its stake in maybe a urban poor area, or maybe in urban poor pockets, or maybe in a rural area. So those people, how we go about it. And this is where my whole focus started on mobilizing and organizing my community in rural Assam. Because when we talk about movement building, it started from mobilizing and organizing the community. For us, the very first step was to do with building the community, because it's not exist as a community such. And we started to do small meetups in small towns and small places like peri-urban areas also. And we have seen people traveling 2 hours or more than 2 hours just to meet, or maybe we are ending up meeting 5 people or 8 people. And for the very first time, you are meeting a same set of people or a group of people like you, and you were surprised that there are more people like you. So in that time, how we think about it. So this is where I want to say to all the participants here, when you look at a queer individual or queer person, definitely we have to look at with different intersection. And this geographical marginalization is also one of the area which we really need to look into, or we really need to count in when we talk about queer lives or marginalization of queer community. I'm glad that Grace Banu is also coming as a resource person for this whole program. Probably already she had program, or maybe she will have session. I'm sure that she will talk about caste, experiences of caste by trans people or the queer people, and how it looks like for queer lives also. When we talk about queer lives in rural India or rural Assam or rural parts of our country, we cannot overlook the cultural context also. For many people, when we talk about living a queer life, we always say that, queering up or reclaiming spaces, a queer life. Living in an urban area and living in a rural area, it's very, very different. So in those time, as queer person or as activist also, how much we are mindful about it. And I saw the narrative, that word narrative also when this session was going on. So in our whole rights for queer community, the narrative, how it is bringing those elements also, it is very, very crucial, because we are not a homogeneous community again. We are diverse with different sort of experiences and different sorts of reality. I'll try to give one example how cultural elements or cultural context brings a lot of values to our queer folks. And in different areas, in different regions, different culture, different community, all these cultural contexts play different way for our community people. In Assam, Bihu is one of our biggest festival. And this is a question to think about also. And this is why I'm just bringing this question to all the participants here. So in Bihu, we have one element called, Loranas, or maybe like the boy who dance, or, the boy who dance like a girl. So a lot of time, boy will be dressed up like a girl and they will just go and dance in that. So maybe just for once, someone is being able to dress up in that way and they are dancing, or they are just expressing, or they are just experiencing their sexuality in those cultural contexts. So in those time, as researcher, because I'm sure that many of the people here are researcher actually. As a researcher, if I go and do research and then I make all these things explicit to everyone, how does it may impact to the queer lives also? That is also one thing we really need to think about as a researcher, or maybe we are in academics also. Because a lot of time, maybe my people who are having a queer resilience through a cultural context in a very localized context, or in a very small area, talking so much about it also may put them into risk. I'm just trying to bring one question, or just trying to think aloud when we talk about narratives also. So one thing is like, good things about building narrative. One thing is about bringing narratives and the danger coming, coming with it, or maybe the risk coming with those narrative also. Maybe you will be so exposed to the whole world, or maybe your life stories will be so exposed to the world, maybe you may become vulnerable. So this is also one reality or one thing when we talk about queer lives or queer resilience in rural area. So this is the kind of sensitivity we have to hold with ourselves when we try to go and work and mobilize our community from different contexts. And how we are being able to go to all those narratives, all those life's experience, and counting those in our bigger narrative, that will be very important when we look at ourselves as activists or professionals, different kind of professionals working for queer rights, be it ally or be it from the community. That is definitely one way to look at. Another thing in the rural context, I see one big element. I look at myself as definitely a cultural worker for sure. So one way is the language, because for example, you go to one rural area and you see about the transgender word. Not many will know about the transgender word. Or maybe the queer word also. I'm very I have been knowing this more and more. Maximum of my people whom I have been meeting in small towns and rural area, they do not know the word queer, uh, or even transgender also. Or even in transgender also, if you know something, then just a very few words. And one question to think also, why you need to know the terminology also? Because you are living your life. You know that who you are. You just need articulation. So in our narratives, when we are working on the right space, then those contexts, those learning, how we are bringing, and we are, including in our bigger narratives. This is also very important when, for example, if I talk about Assam, go to Upper Assam sites in villages. Everyone had their own coding or own way to describe themselves, and they don't know apart from them, and they describe themselves in that way. So I see more and more identity coming up when we talk about LGBTQIA plus plus. So I see in those plus plus those localized language way how they have defined themselves, those identity also come. And then how we are counting them, their experiences, that is also very important. So this is definitely one thing we need to look at, how when we work in the right space for our community, because it's their life story, it's our people's life story and their narratives and their lived experiences, and all these things counts when we talk about movement building practice. Because we being small in numbers, less visibility when we're talking about movement building, all these narratives, all this context has to be included before it get lost maybe with some bigger narratives or something like that. Or over past decade or past experiences, we can see that how with some hegemonic narrative, some other voices, get suppressed. That is very important. For example, when we talk about transgender rights in Indian context, then looking at Northeast as a region is very crucial, very different. When you talk about transgender rights, you go to Mizoram and ask me, will you be able to talk about transgender rights in Mizoram? Because their regional institutions, religious institutes of church and other cultural contexts, how it play in the whole setup and how it allow or doesn't allow, those questions also comes. Maybe in Delhi something is happening, in Mumbai something is happening, but in a small towns of Mizoram, or forget about small towns of Mizoram, in Aizawl, the capital of Mizoram, the reality will be very different. So in that time, how we are being able to bring those voice to the mainstream, that will be also very important when we talk about real reality and bridging the gap. Few months back, in Nagaland, one of their rebellion group, they put out a notice, or it's like a circular kind of things that this is banned. It's not part of our society. It's not part of the culture. Many people out of Nagaland reached out to me and told me that as a National Council member, why don't you intervene? Why don't you say something? Because I'm serving as a member to the National Council for Transgender Person, and probably the whole 8 states of Northeast. Also, all these concerns comes to me. And that time, my answer was that I have to talk to my community people in Nagaland, and then only I can react or I can say something. Because sitting in Guwahati or maybe sitting in Delhi or sitting in Mumbai, we can just comment something on it, or we can just think ideal in one way. Oh, this is so wrong theoretically, and this is not done, this is not lawful also, and this is it, and you can build a narrative. It's very easy. You just reach to media, and all of us have reached to media and all sorts of medium with us. But then by doing so, am I putting my community living there in risk? Because in my DMs or through different channels, whenever I talk to people in those interior areas, they always use account which is not in their name, social media account, or which do not have their photos, and they always say, "Ki, we live every day on a situation which is very scary, and I don't want to move out of my space. I don't want to move out of my town. I want to be here, and I'm not reaching out to you with expectation that you will come and do something. I just want to tell someone, because here there is no one even to listen also. Here I do not have anyone to go and tell also. I just want to tell someone. So this is also one of the reality. So can I leave those people behind me? That is also one question we have to ask when we are working in the uh, you know uh, uh, trans rights or queer rights setup. So these are some of the thought-provoking situations or questions we need to ask. And this is where I can see now that in India, many activists, many people are coming up, working in small towns, working in rural area, working from a caste oppression angle, and the class division, and all the other social realities. So and I see hopeful, like I see a lot of hope in that, that our movement is growing in a true intersectional manner, and that is very, very important when we talk about this whole urban divide or urban rural divide, or class, caste, religion, all this divide when we look into it. One of the biggest challenge what I see from rural reality, of course, Dr. Aqsa was sharing because some questions were there, access to healthcare. This is one of the biggest worry. Uh, because in rural area, the nearest big hospital is the civil hospital in your district headquarters. And in the civil hospital in your district headquarters, you do not have any facility for a transport. Maybe there is a just there is no even the reference about it, or just think about any states of India, uh, and then how many medical colleges they have, and if they have also what kind of conditions are there. For example, in Assam, for longest we had only 3 medical colleges, and then now we have more medical colleges. It's not 3 anymore. But in all the medical colleges in Assam, if I talk about it, we do not have facility for a trans person. Then in that time, how we put effort, collectively, so that it become accessible for everyone. So lot of work needs to be done. It's not a one day of work. The work has been going on, and the work will be continuing also. But then we have to be very mindful about it, that healthcare is one of the biggest issue, because I have met people coming from Nagaland just to see a doctor in Guwahati. I'm talking about the trans men who came from, Nagaland, and then they did not even get an appointment also, and they need to go back because they do not have a lot of resources to stay back and do whatever they need to do. So, for example, from Upper Assam, everyone needs to travel to Guwahati because the Guwahati Medical College have some sort of, I'm saying sort of facility, but it has to, it has to increase. That is definitely one issue or one concern. A lot of things we see in rural context is the school dropout. or not being able to access to higher education. Because the education institute, the binary systems and all, and especially in class 9 and 10 standard, when you hit puberty, where your behavioral changes are coming and everything, that time you face a lot of bullying. Your teachers are not sensitive. The whole support system around you, it's not working as a support system for you. So we see a lot of school dropout during that time, and which leads to unemployment later on, which leads to not being able to go near to a sustainable livelihood solution. So with that, we can see this whole lack of livelihood for our community, especially who are living in rural area. Uh, that is one thing we really need to consider when we talk about intervention, or when we talk about working for our community, or talking about the community, or building narrative also. In this, I see most, this is my opinion from my observation for past few years, in livelihood, most of the trans men are more vulnerable, because being a female assigned person, your mobility is restricted. Uh, your parents do not really allow you to go out for work, or they do not want you to take risks to start some small business or something like that. So we see, especially from rural area, it's the female assigned person who are trans masculine or trans men, they suffer a lot. So, and they need to sit at home also, because otherwise your parents will force you to get married also to a man. So these are some of the reality. And a lot of time I have seen, especially in Assam, I have seen from rural reality or small towns, trans masculine or trans men, they cannot even migrate to bigger cities in search of livelihood. But with trans femme folks or trans women, or maybe who goes to gharanas and all later on also, somewhere or the other way, they try to find a solution, or they try to find one way for the livelihood solution. I'm just saying, try to find a way. Again, it's not established in that way that you have that sort of things. So traditional way or the any other way. But when I talk about sustainable livelihood, it's the most vulnerable, as I said. So these also we have to be very mindful when we are designing, or we are thinking about intervention, and we're talking about rights, and how we are bringing all this reality to our mainstream development work, or development intervention, when we talk about our community. Doing intervention in school or education systems, going to small areas, college or universities, these are very crucial when we talk about narratives, or for queer resilience in small towns or rural areas. And this is where my whole work also evolved. In past 2 years, I have been into more than 50 college and university in Assam, and I have reached to more than 12,000 young people talking about the rights for our community. And trust me, all these colleges are mostly from small towns and rural area. Only one college I have been into in Guwahati city. But in Guwahati city, there are many. And it's a surprising fact even for me also, that in last 2 years, it's just one college I have been into Guwahati city, but all the other colleges are different rural area or small towns in Assam. So it is that people wants to listen also, and people wants to talk about it also, and how we are being able to build a narrative involving all the different stakeholders or different people from our society, be it from popular media, be it from media, be it from academia, be it from bureaucracy, be it from corporate. These all are very important when we talk about queer resilience and bringing all sorts of voice to the mainstream. Uh, so this is one of the strategy I have adopted, and I have been, trying to go ahead with, and it's working. At least for me, I can see, because in Assam, we can see that in mainstream, the narratives for the queer community, now we can access. It's through poetry, it's through popular medium, it's through colleges, university, government agencies, civil society, uh, cultural spaces, all these things works together to contribute to the bigger narrative. And this is where we can go towards building a strong movement together. And this also comes as for me as a movement building practitioner for sure. So now I can say it's already 5 minutes I crossed, or 10 minutes probably. So I will take a pause here. Probably if anyone has question, then I'll take.
Thank you, Rituparna Neog for providing such a comprehensive and enlightening section. Now, I would like to invite our chair, Professor Vibhuti Patel for her remarks on this session.
Thank you. Rituparna ji, you are a very powerful and captivating storyteller and also fascinating educator. I must say, I'm listening to you second time. I have read a lot about you. But my first question is that how do we reach out to the school education, the educators in school system, because that is where gender socialization gets consolidated. Do you get opportunity to conduct sessions for the textbook writers of the school boards at the state governments? Because NCERT schools, the central schools are very limited in number. They may be in hundreds, but school boards and schools, high schools are in thousands and maybe tens of thousands.
Thank you, Professor, for the question. This has been one of my biggest efforts, and my work is also involved around it, engaging in education space through storytelling, stories around queer lives and all. I'm working with children. So I have trained educators, not textbook writers for sure, because for that it will take a lot of time. Intervention has to be done from government. And as I am part of the welfare board in with government of Assam, and I'm trying to push the government to do so. But then all of us know how much time it takes. So I'm just hopeful. But school teachers, I have been training, and a lot of time we think that school teachers are very rigid. And they don't want to welcome ideas, or they don't want to listen. But in my experience, they are one of the set of people who really wants to listen, because they're educated and they know, they understand. It's just they do not have access to information. So I was invited to Diet in Dibrugarh district last year. Diet, all of us we know, District Institute of Education and Training, where people come for B.Ed and DLED course and all. A lot of teachers comes as a deputation also. So it's most of them were government school teacher. I was invited for a 2-hour session. And trust me, I also don't know from where I got the energy that day. I spoke for 4 hours that day. I was standing for 4 hours and I was speaking to them. They were so engrossed in so much of question. So many teachers, they stood up at the last of the session and they said, I have been teaching for 20 years and I don't know. And I feel today I feel ashamed of myself, and I'm a science teacher. One of the teacher who is my father's age, my father is also a high school teacher. He said that today only I got to know, and I was probably insensitive towards someone in some days. One of the faculty teachers, she stood up and she said, I have a boy, and from today I know that I have better way to raise him and also to look at my students. So these are feedbacks from government school teacher. They want to listen and they want to engage. And personally also, in my public life in Assam, it's so many government school teachers who very regularly text me, hey, hello, madam, something is happening in my school. I know one child of this, their behavior is like this, their articulation is very less. Behavior is like this. What should I do? Look at the openness. So I feel a lot of hope in that way. Right now, from our side, we are designing one program. Hopefully, we will get government approval to pilot the project in school in one of the districts in Assam. So that program, it's one of my long-term vision to work in education space to develop a school environment in a gender-sensitive way, so that students get sensitized. Most importantly, the teachers get sensitized and their capacity get built to develop a school as a gender-sensitive and inclusive spaces, because schools are horrible spaces at times for any child, I'm saying. So we have a lot to do in school spaces, but very strategically we have to involve, we have to get involved. If one person has some connection with government, someone who listen in the government, I think they should use that power, that voice, so that from there a circular comes and you can enter to school and you can do something. So very strategically way we have to go. So my team is also here as participants. So we are trying to do something which is a structured program targeting high school in Assam. So we will pilot in one district in Assam. So hopefully in coming months or in 1 year, we will be able to share a learning with the larger world also. So yes. And we have
Are you going
library.
to have a process?
Yeah.
So are you going to have a process documentation of that pilot, or do you
Yes.
also have a training manual which can be translated into other languages?
Yes.
Yeah, because
So
here we have 8 grassroots activists from organization called Coro. They are into literacy mission. So they
Okay.
are extremely capable lot who are playing very important role in the school education.
Definitely. I'll write to you also. We will have definitely a process documentation. These are all our part of work. And that module which will be developed will be also public resources, because we run free library, and free library believes in free access to resources and information and disseminating it to in free of cost to people. So yeah.
Thank you. So inspiring.
Any participants have any question?
Thank you,
Coro
ma'am.
team,
With that,
would you like to share your grassroots experiences? Coro team members, you are here. Mumtaz ji, are you there? आप हिंदी में बोल सकती हैं. She says she doesn't speak because she speaks in Hindi. So she is also with Coro, and I think there are many other.
हाँ, किसी को अगर हिंदी में भी बोलना है तो आप बोल सकते हैं. Okay.
Hello.
Suppose.
Yeah. Okay. Okay.
thank you, ma'am. With that, we now open the floor for questions from participants. Participants can either raise their hand or type in the chat box or Q&A box. Yeah, someone has raised their hand.
Yeah. Go ahead. Go ahead, please. Go ahead, please. Yeah. Yes, please go ahead.
Hi, am I audible? I'm not sure if I'm
Yes.
okay.
Yeah.
Thank you so much. Thank you very much, and thank you, Rituparna ji, for such an amazing talk. I thoroughly enjoyed your talk, and the best part is because I was so interested to know the rural side of the picture, and you obviously, represent it, and you spoke on it very, very carefully. I wanted to know if you could, since you've been, dealing with teachers and educationists and different parts of the society in India, how would you consider India is a big country? So, from the rural aspect, is there any part of India that you believe is more friendly towards this whole LGBTQIA concept? And if you see any pattern, can you also please comment on what are the reasons for that? Is it to do with the basic education or the acceptance by major stakeholders, including teachers or educationists? Or is it to do with a lot of politics there out there? Because, I was looking at an article last week and it was about South Asian context. And I found out that although the generic problems are obviously the similar ones, the same ones, but we do have pockets in parts of South Asian countries where we do have, some positive things as well going on. So if you could look at India in a bigger picture and comment on which parts do you believe are more friendlier and the reasons for that, please. Thank you so very much. I'm sorry for the long
Thank you
question. Thank
so
you.
much, Gohil. Thank you so much. I loved it. I love the question because I have been always talking about my experience. I am a development professional besides my work in transgender rights work. So in my whole professional life, I have been working with rural women mostly. Darshana, can you mute yourself? Or maybe the host can do that. Yeah. Thank you, Darshana. Okay. So in my professional life, I have been working mostly with rural women, and I have been living in rural areas also a lot more of my time. And during COVID time, I worked with groups of women in Guwahati city who are street vendors. So this is my work. I do not deal with highly educated, sophisticated people, quote unquote. I always work with people from periphery, and I have been, part of their life. They are my, life, part of my life. And I also come from a village. My village is one of the poor village in one district. You can say that not every household have all the basic amenities in my village. So in my experience, very straightforward way, I can just say more acceptance I found in rural area. लोग मुंह पे आके हंसते नहीं हैं आप. If someone has question, they will ask you, come and ask you politely. कि ये क्यों है, ये कैसा ऐसा क्यों है, कि किसी का मजाल नहीं है कि आके आपके मुंह पे हंस के चले जाएंगे, क्योंकि वो लोगों का अंदर से आते हैं एक acceptance गाँव में. I am not sugarcoating this, or I am not romanticizing also. These are very romanticizing ideas also when we talk about people from rural area. This is lived experience. I'm still a part of rural India because my family still live in rural area. I also go time to time and I live there. So that is one. Nobody judged me never in that way. Of course, if I talk about a state-wise or in that way, definitely I will maybe be biased about my state. But honestly saying, in Assam, I feel most safe. But for sure, for that, there are different agencies work around me because I'm a local here also. I know the cultural context. I know many things, and many things are in my favor. Because of those agencies, maybe I feel more safer in Assam. That can be one thing. But again, I cannot put one way of one region also that this is very difficult to survive. No, it is not like that. Recently, I was in Bhopal and I went to some bastis for some work. The kind of acceptance and love I received there in those basti, it was wonderful. It was beautiful. Like I was there for a visit. The next day, I got a call that they want to invite me for their iftar. So I again went next day for iftar. I never imagined myself being a trans person will do iftar in a basti in Bhopal. So much of love people showed. In Rajasthan, I always say this story of Mirama. Mirama is one of the oldest Karyakarta of MKSS. She lives in Dev Dungriya, Professor. You know, maybe you're nodding your head.
Yeah.
Yeah. She is full of love. That women, she listened to me once in a virtual workshop for MKSS fellows, and she was listening to the fellows. She's not a fellow. So, and she was listening and she got everything of mine what I was saying because the whole session was in Hindi. And I went to Devdungri once. I was in the highway, the main road, and she saw me from distance and she was like waving Rituparna, and I'm like, who is calling me here? Like, who knows me? I was surprised. It is Mirama. The kind of acceptance she showed, and what she told me, she held my hand and she told, Ritu bolte hai, she called me Ritu. Ritu, you told these things that day वो meeting में मैंने उस बात को सुना और उस बात को काफी बड़ी मैंने उसको फैलाया, उसने बोला. So whenever she goes to any protest, any rally, if she's meeting with some groups of women, she will go and talk about some transgender issues, trans identity, because she listened to me in one session. This is rural women. And that's the solidarity I talk about. From the cis women, what we receive as transgender person. My mother, she is mobilizing her whole community one by one step at a time in rural area. For me, a lot of time I say that my fight is easier, but my mother fight is not that easier also. And it's mixed. Always it has been. In South, I have a very different experience. In Hyderabad, they're very different. Mumbai, different. Rajasthan, as I said, So in Pondicherry, when I went, very beautiful experience I had. So in Himachal, in Pahar, and I have been to many states in Northeast. Very surprisingly, I had bad experience in one of the space in Meghalaya, but in 20 places I had a beautiful experience. But I will look at the 20 experience. I will not overlook the one experience. So that is also one thing, right? So it's a lot to do how we are building conversation around us. One thing I want to tell whoever is queer person sitting here, one thing we have to build conversation around us. Something we have to give, something somebody will give us. So, and we have to find a midway. Conversation is one of the way, no matter who are in front of us. And we have to build relationship. We have to build relationship with people, and we have to build community for everyone. It's not just queer identity. As a queer person, if you belong to upper class or upper caste, how much accommodative you are for other caste oppressed person or who are coming from rural area. In my behavior, maybe if I'm a very classist person, somebody will feel marginalized, though that person is a queer person. So it's a lot to do with our reflection also. And I'm very outrageously saying this. We know, I know what I'm meaning here also. So it's about every one of us as human being, how intersectional we are going, how we are reflecting in our behavior and language and our soch and nazaria, and we are accommodating everyone. Me, probably me means XYZ me, belonging to a upper class or upper caste queer person or a trans person, this XYZ person can be very discriminating towards a Dalit person or a baby disabled person. So what about that then also? Where the acceptance goes, where the accommodating everyone also goes, right? So we have to look into that way. Together we have to strive towards building a peaceful society because we know what we all are going through. And all of us is collective responsibility to build our society as a beautiful society where everyone has space and voice. So yeah, thank you.
So we have Parijit Mahapatra ji raising their hand.
I think I'm so sorry. I have to leave. My other meeting already started from 6. So I took a 15 minutes of buffer time. But I'm so sorry. Another meeting is a board meeting, so I have to be there. So Parijit is my team member. Please, Parijit, ask me the
I think
question.
you can directly communicate with.
Yes, yes.
Parijit is my team member. So he will ask me.
Okay.
I'm so sorry to all the other participants. If you have any question, please forward it to Ritika through Professor Vibhuti Patel. I will drop my response in a mail and they can mail you to every one of you so that no one will miss those response. Yes.
Can we share your email ID?
मैम यहाँ भी चैट में अगर क्वेश्चंस आ जाएगा ना तो मैं ऋतुपर्णा जी से शेयर करके कर दूँ.
Ritika, please you take all the question and forward to me. I will put and please send to every participants.
Yes,
Okay.
Okay.
Thank you so
Thank you,
much.
ma'am.
Bye everyone.
Thank you.
Thank you.
Bye.
Moving on to our next session by Dr. Debolina Deji, teaching faculty at Aziz Premji University. Dr. Debolina Deji will guide us through the topic of queer, noun, adjective, and verb. We have Dr. Debolina's lecture recording with us. We will be playing that.
Beyond Binaries, LGBTQIA plus narratives, #VR. This is our second cohort on Beyond Binaries, and I'm very delighted to invite Debolina Deji. Debolina Deji is currently teacher at Aziz Premji University, and she has previously taught at Ramjas University. We are excited to have you here with us, ma'am. Welcome to IMPRI, and we look forward to hearing from you.
Thank you, Arjun and IMPRI for having me again. And I'm sorry, apologies for having to record this session. I'm on a time difference. I'm not in India currently. I'm doing research. I'm on a fellowship somewhere else. So sorry for not being available sort of online, in person, live. So I wanted to firstly tell you where this lecture that I have prepared, where this is coming from and why I have prepared this. So I've usually been on a few queer panels and I've spoken about my personal life. I've spoken about my own journey. And a lot of that has been about my personal experiences, about love, about sexuality, all of that. But I find that as I am in my 30s and late 30s, as I am on this queer journey, and queerness is a journey, I find myself moving beyond ideas of love or sexuality into other ideas, right? For me, queerness is not just a moment of the romantic encounter, but it is more, and it has become more through the act of telling these stories, but it has also become more through my own profession of teaching. I taught at Ramjas. I taught these 3 semesters between 2021 and 23, 3 years of teaching this course called Interrogating Queerness. And I realized that the moment I stepped on in a classroom to teach it, from being queer to teaching queerness, teaching about queerness, or teaching this course called Interrogating Queerness, that something shifted, right? It became more than a personal identity, but also something else. I think my own PhD work, which was on 19th century disease, actually was not on there's no word called queer in that PhD, but it was very much about queerness, because it was about pathologization, it was about disease. And so what happened from my early 30s to my late 30s, as I looked at the word queer and I sort of was looking at it from different angles, I started to think about whether queer was a noun, whether queer was an adjective, or whether queer was a verb. So when I would go to a lot of these panels, I would say that I identify with the word queer both as noun and adjective. And while that is true, in my late 30s now, I need to say that I also use queer as a verb. And what does it mean, right? What does it mean for queer as a word to be noun, to be verb, and adjective? Now, most of you know, when you hear the word queer, we're mostly thinking about a noun. What is a noun? A noun basically classifies a group of people, right? So when we talk of a noun, we talk of a label, that I am queer, right? I am queer. So it signifies certain qualities, it signifies certain classifications. But queer as a word actually began as an adjective. It began as a word with certain qualities, pejorative term. And queer theory and queer theorists and queer advocacy actually stretches that word queer beyond being a label, which you can wear as identity. It was an adjective, it became a noun, and in my life and by reading other queer theorists, the attempt is to make it into a verb, to make it into a method, to make it into a tool, to make it into a way of seeing things, a way of living life. So my session today is called Queer Noun, Adjective, and Verb, because I don't see myself necessarily as an activist, but more of an advocate, more of the profession that I'm in, which is to teach. And that is the way that I practice queerness, right? I practice queerness as a lens, as a very loaded word, but not as less as a noun, which is, this is the right way to be queer, that this is the only way to be queer, right? More towards the verb. Now, what does this mean? Now, let us please change slide. Now, no matter how much we stretch the word queer, in a sense, it comes as a word in relation to the heteronorm. What is the heteronorm? As most of you know, the heteronorm means a certain reproductive logic at the center of imagining families, right? So the word queer, or the word gay, lesbian, LGBT, all of these words come in relation to how we imagine families, or how we imagine the reproductive logic of sex and sexuality, right? So I just wanted us to begin by imagining what the heteronorm looks like. And for me, the heteronorm looks like the word O, or like a center. It's a circle with a dot in between. It's what the norm looks like. It's tight, it's a full circle, it's a neat O. And for me, when I teach a course on queerness, I imagine the letter Q. Please go on to the next slide. For me, this is a word that Michel Foucault uses when he's talking. He's not using the word queer, but he, in one of his last interviews, he means we are moving, because the word queer doesn't come into circulation before the 90s, right? And this is one of his last interviews. But in my reading of queer, I look at the alphabet Q, and I think of that neat circle of the heteronorm with a center being cut, being disrupted. And this is what, Foucault calls the slantwise obliqueness. It's almost as if your relationship with that norm is being disrupted by this letter Q. It's that neat circle with a dot in between, with the center, with the heteronorm being disrupted by something. And in a sense, we understand the word queer with this slantwise obliqueness as a certain relationality to the norm. That whatever the norm is, this is like a slantwise obliqueness. It is something that disrupts that neat norm. Okay, next slide, please. Like I said, right? The disruption of certain stable categories that have to do with sex, gender, sexual desire. And it is important then to mark the continuities as well as the ruptures in the way that words like lesbian, gay, these work as categories, as precursors to the word, the idea of queer destabilization. Like I said, the word queer actually is reclaimed in the 90s. But before that, obviously, you have critiques of what is called compulsory heterosexuality. But even the idea of the homosexual before queerness, queer as a term came into circulation, is discursively produced. Now, what does that mean? So if you look at when did sexuality become an identity? Most of you know that there have been scholarships that have looked at, even in ancient Greece or in ancient India, that homosexuality is nothing new. If homosexuality is nothing new, then when does it become identity, right? If we look at 19th century, and this is what Michel Foucault argues, that it is around 19th century, late 19th century, that sexuality actually becomes an identity. It becomes a label to wear, so that if men are having sex with men, then you say, whereas back in the day, if men had sex with men, they didn't necessarily call themselves gay. But this new way of identifying oneself, which is identity politics, happens in the late 19th century. And if we look at late 19th centuries, it is a period, especially in Europe, European 19th century, it is obsessed with deviant bodies, bodies that are different from the norm, sexualities that are different from the norm. And there are three lenses through which we look at deviant bodies. We either pathologize them, we call them sick. This is an illness. We criminalize them, say that this is actually criminal, or we sexualize them, right? We also say that this is a way of looking at it that is about deviant sexualities. Now, when did sexuality sort of become, in a sense, like I'm saying, like an identity? Like if you have sex, if a man has a sex with a man, then you are gay. Like it essentializes you, right? Because if you look at queer theorists like Anna Marie Hagose, who says that back in the day, because sexuality is constructed, it is, so if a man was saying, he was not lying. So if he was saying that so he says, Anna Marie Hagose says that constructionists would not assume that a man was lying or deceiving himself when saying, I'm not gay. If I was gay, I would kiss the men I have sex with. I never kiss men. So in a sense, constructionists look at um, uh, how identities are constructed, right? That there can be different meanings that are attached to the same sexual act, that just because you have sex with men does not necessarily make you gay. And that constructionists would argue that identity then is not an demonstrably empirical category, but happens through the product or the process of identification. It happens, as we know, right? You have to, it's not about somebody saying that, oh, you've had sex with a man, so you're gay, but you have to identify yourself as gay. So a process of identification. Next slide, please. So other theorists like Nikki Sullivan, who introduce queer theory, then speak of queerness as in different registers, in different ways of approaching the word. And Sullivan says, queerness is to make strange, to frustrate, to counteract, to delegitimize heteronormative knowledges and institutions, and the subjectivities and socialities that are informed by them and that inform them. And Nikki Sullivan's introduction is really useful. Please look at it. Starts to look at the evolution of the homosexual identity. How is this identity discursively formed? What do I mean, or what does Sullivan mean when they say that this is discursively formed, and looks at 19th century terminologies. In 1869, the Swiss doctor Caroline Maria Bankert coins the term homosexual, but there were other terms like same-sex, right? But interestingly, David Halperin asks that, for example, in classical Greece, you had the term of the pederast, right? A married man who periodically enjoyed sexually penetrating an adolescent man. So is the category of the pederast the same as, let's say, the Native American Indian adult male who from childhood has taken on many aspects of a woman and is regularly penetrated by the adult male whom he has been married in a public and socially sanctioned ceremony. Then he goes on to talk of New Guinea tribesmen. You also know that in the Middle East, there was this tradition of bachabazi, right? Where young adolescent boys danced around older men, and similar practices. So what Halperin asks is, what are the commonalities between these different categories of culture, of what we think of as homosexuality, and the expressions of homosexuality in these three different expressions of culture? And do these categories then share the same sexuality with what we think of as the modern homosexual? Right? Next slide, please. So if homosexuality has always existed, then when and why did it become a crime, a sin, deviance? And when did it become identity politics? When did it become a label that you wore, right? And Nikki Sullivan looks at it, but also Michel Foucault looks at it in the late 19th century, that it not only became a sin, sodomy especially, but also it became a legal identity, because it got framed legally, right? As you know, I mean, a large part of the activism in India has been about decriminalizing 377. So, so in the late 19th century, actually, the law said that certain acts of sex was punishable, like sodomy. It was considered to be against the law of nature, but it did not say that it was about a certain category of persons. So actually, by that logic, even oral sex was punishable as being against the order of nature. But I mean, you wouldn't imagine that just the act of oral sex would make you a homosexual, right? So the way of having sex and the kind of person became one, right? It became an identity because it got framed within legal discourse. So sodomy actually started to become more and more gendered, whereas we know that sodomy is not necessarily gendered. So the 19th century homosexual then became, as they say, a personage, a past, a case history, a type, because the 19th century really is obsessed with creating categories. The 19th century is responsible for taking all forms of fluidity and turning it into a category, because it was obsessed with categorizing and naming any kind of behavior, right? It is an age that is obsessed with categorizing behavior. So sodomy or oral sex or even contraception, all of these were considered to be against the order of nature, because only reproductive heterosexuality was the norm. Now, that kind of sex became synonymous with a kind of person because of legal history, because of the way that it got framed legally. So, and this is what Foucault says, that the 19th century homosexual became a personage, a past, a case history, and a childhood, in addition to being a type of life, a life form, and a morphology with an indiscrete anatomy and possibly a mysterious physiology. So, despite the fact that there were many expressions of male to male sexuality, right? Like we were just saying, the Greek pederast in New Guinea. It started having a name, a legal identity. It became sort of an identity in the way that we understand it now. So the sodomite back in the day was a temporary aberration, but the homosexual was now a new kind of species, right? It got a name. It's almost as if the way you had sex said something about you as a person and something deeper about you, right? You are a kind of person because this is the way you have sex. And so this is a late 19th century invention that gets framed within the law. Next slide, please. You have homosexuality as a basis of a person's nature, not simply as one of the things you do. It's like, if you, just like, you know, our modern identities of eating, for example, you'd say, oh, I identify as a vegetarian, right? Similarly, I mean, probably 100 years back, if people, the way people ate had nothing to do with their identity. Similarly, the way people had sex was just one of the things they did, not necessarily something deeper about them, right? So in the 19th century, I'm not going to go into detail about this. You can read Nikki Sullivan. So different kinds of discourses, right from doctors to psychologists, uh, they start trying to understand sexual deviance, or what they think of as sexual deviance. And there are different people from Ulrichs to Havelock Ellis to Carl Westphal, who try to understand sexual behavior in terms of deviance. Okay, but what's important is it is framed within the discourse of deviance. It is seen as something that is aberrant, something that needed to be studied. It's almost as if in the past, from it being a kind of behavior which happened in Greeks or Indians, it was something that you did, to being now a type of person that needed to be studied under the microscope in a laboratory, right? Who are people who are women who are drawn to women, who are men who are drawn to women, right? So it became, in a sense, the homosexual became an object of inquiry, an object of study. And again, think of 19th century obsession with pathologization, with criminalization, or even just, 19th century European culture, if it found something that was different, it either put it in a lab to study, in the jail as criminal, or in a museum as an exhibition. So all of these attitudes to anything that was different or deviant or aberrant. Okay, next slide, please. So in the 1950s, obviously, when you look at the emergence of an identity or identity politics, of course, you look at various societies and organizations that come forward with decriminalizing homosexuality. I'm sure you know this. I'm not going to spend a lot of time. Please, next slide. Next slide, please. So through the 50s to the 90s, I'm just really doing this service by not talking about it, but I'm just going to come to the word queer, actually. That starts being reclaimed in the 90s. Now, it's very important to understand why the word queer is different from the word homosexual, or why did we need to have this word queer if we already had the word homosexual, lesbian, gay? It's probably because of two attitudes that we see even now among people who identify as LGBTQIA. One was obviously one part of the movement had to say that, look, we are like you, we are not different, we are the same, we need rights, so give us rights, right? The homophile movement said that give us rights because we are no different. Usually the homophile movement or people who argued in this way said that, this is a gene, we have nothing to do with it, it's not our fault that we're gay, and, give us rights based on that, right? The homophile movement. So, and this is a part of this is one part of the LGBTQIA asking for rights, asking for acceptance, saying, please accept us. And the other part of the LGBTQIA, which had to do with trans folks, which had to do with gender non-conforming folks, which a large part of it had to do with Stonewall riots, actually saying that we do not belong, or we do not necessarily believe in the respectability politics. We are different, we're radical, we don't want to be the same, right? So queer, actually, in a sense, in the 90s, actually, you see a little divergence, which is not the same. So even though we use the word queer as an umbrella term for LGBTQIA, in terms of the history of the word, it's slightly different because it carries, it is not about the homonormative. The homonormative, in a sense, it says that, we are men, we have a baby, and, we believe in the same things that the straight world believes in, we're just two men, or so. But the word queer actually has always been associated with what is not normal, right? Counterfeit money was queer. Someone who was sick might say that they were queer. Playground bullies would call someone queer, right? So it was always, it had nothing to do with sexual connotation necessarily, but it had to do with the strangeness of the meaning, right? So, so the first time that the word queer was used, according to the Oxford Dictionary, was in 1894 by the Marquess of Queensberry. But if you look at the word queer was an adjective, where I began with, right? So for the first time that the word queer began to mean homosexual was about 1914 in United States. The point was to make the word derogatory from the outside and not from within, which hints that it was being used, it was being embraced as a self-description even then. And this word self-description is very important. So the word queer obviously slowly evolved, and what's important in the evolution of the history of the word is in 1965 of the Webster's New World Dictionary, it lists the word queer as both noun and adjective as a slang for homosexual. Um, and as the website notes that it's not offensive slang, just slang. So in the 90s, you had um, a, a certain group of the LGBTQIA reclaiming that word as a non-pejorative designation in the spirit of gay pride. So for the longest time, the word gay pride and queer were actually very close. And the word queer started being transformed in the late 1980s. Now you have to understand that this transformation, why I have named it noun, adjective, and verb, is this transformation is very important. When you use a word that had heavy connotations of pejoration to a word of self-description, it's an act of reclamation of power. But yeah, next slide, please. So now we come to the verb, right? Not because theory is verb, but because I think for a lot of us who've been with the word queer or have been with different connotations of the same verb, we look at it and we say, okay, sexuality is great, love is great, romance is great, but then what? What do we do with it? And here I approach the word queer through three categories that again have nothing to do with love or romance or desire, but three categories that are outside of desire or sexuality, but also linked to it. So those three categories, one is friendship. So we discussed briefly Michel Foucault's friendship as a way of life. The second is the category of happiness or unhappiness. What does unhappiness have to do with queer genealogy? So Sara Ahmed's essay. And the third is the concept of time. Judith Halberstam has written quite a lot about queer time, and the idea that queer time actually critiques a certain teleological, straightforward idea of adulting. Okay, so we're just going to spend 10 minutes and look at the verb queer. So what do we do with queer? If you, like me, are trying to lead a queer life, what does it mean beyond romance and sexuality, right? What does it mean to have a queer way of life? Can you have a queer way of life if you're aromantic, if you're asexual, right? Not necessarily through this lens of who you marry or marriage rights, even though that's important to a certain section of queer identified people, but also like beyond that, what would it mean to have a queer mode of life? What does it mean to have a queer life? So what Michel Foucault, because he's writing in the 1980s, it's one of his last interviews in 80s. In this essay called Friendship as a Way of Life, Foucault looks at the word friendship. And just like the word queer is very vague, right? It's been reclaimed. So because in the 80s you don't have Foucault talking of the word queer, but in a sense the word friendship here is very much aligned to the word queer as like a hold-all term, just like we think of when we say queer, we say it's an umbrella for all these different identities. Friendship too is a very ambiguous word, right? It is not something that can be easily defined. And because of this, Foucault actually looks at the category of friendship and says, what if it was about a way of life? What if homosexuality was not about um, a deeper truth, like I was saying, because it's Foucault is one of the first theorists to say that homosexuality as an identity is invented in the 19th century. In the 80s, in the same essay, he says that what if men just wanted to live with men? I mean, okay, sexuality is important, it's one part. But what if your sexuality, who you had sex with, had nothing to say about something deeper? Like, we've had all these myths about coming out, and at one point, of course, coming out is important, but it's not as if coming out, like I've always said, right? And not just me, other people have said that straight people have private and public, but the homosexual has the public, private, and the secret. It's almost as if you always have this secret about you that you have to, that queer people are actually framed within this bracket of secrecy. So what Foucault is saying is that this word homosexual is, he refuses to pin it to a deeper truth about the self, that queer people always have to confess something, or we are in this confessional mode, something deeper because of the way we have sex, right? Rather, he uses this category of friendship to arrive at a multiplicity of relationships, right? Not as a form of desire. So he's talking of friendship, he's talking of homosexuality, not as a form of desire. So there are many kinds of desire, and this is another form, right? But as something that is desirable for men to live with men, right? And for Foucault, the central question is not about whether men have sex with men, and that is what automatically makes you a homosexual. I mean, think of actually this whole category of M to F, right? M to M, like men who have sex with men, or MSM, right? Why is that category not gay? Why is that category not homosexual, right? Because it disrupts, it brings into question how identity politics works. So Foucault's not interested about men who have sex with men and that it automatically makes you gay. Foucault's interested about men who want to live with men, right? Because as long as it is about sex, it does not disrupt anything. And we know this. As long as you do it in the privacy of your house, as long as I don't get to see it, it doesn't cause me distress. But the moment it becomes a way of life, a mode of life, the moment you want to live as a homosexual, in Foucault's words, the moment as women we want to live with women, or the moment it becomes a way of life, a mode of life, it starts to become a desire that breeds uneasiness, a desire in unease, okay? And what Foucault says is that there is no recognizable blueprint for this formless relationship, this way of relating to each other. So how do men who want to live with men, what kind of life do they adopt, right? And we know this. This is a central problem because we don't have histories of how men have lived with men. And at one point, Foucault actually thinks of men who fought in World War, who lived with each other, who saved each other probably in crucial moments, gave up their life for the other person. And he's talking of, he's saying, imagine the kind of emotional bond or emotional storm that these men had for each other. What name can we give to this, right? How can we talk about these extreme emotional bondings between men? So this way of relating to each other, men having affection for men, men having love for men, men wanting to live with that affection. So what Foucault says is, as long as homosexuality is about quick pleasure, it doesn't have any unease. It doesn't generate unease. What is troubling is not the sexuality, but the possibility of affection and tenderness. The possibility that men having affection for men or women for women, even though he doesn't talk of women that much, that it becomes a mode of life, right? Homosexual, according to Foucault, is not someone who just chooses to have sex and then gets it over with. It's someone who chooses to live with a man, who deals with the central problem that I'm a man, I have affection for another man. How do I live with this man? Right? And he talks of it in the army, like I said, in First World War, where love between men is constantly provoked, it's shamed. But he looks at these relationships and he says that these are relationships with multiple intensities. And what is important is that this is a relational system. Now, I've used this word relational before as well, and this is a word he uses all the time. Now, it's very important to understand this word relational because it's at the center of when we say that it's a critique of the heteronorm. Now, the way we relate to each other, right? You are my husband, I'm your daughter, you're my wife. What is the center of this? The biological family, right? Reproductive heterosexuality. This is how we relate. In fact, our entire sociology, if we look at sociology, is around families. And friendship is actually a very ambiguous term. It's a very amorphous term. And it's a word that has no definition, right? She's my friend, he's my friend, friendship, right? It can be a very powerful um, uh, queer tool like it is now and becoming more and more, but it can also be a very dilute word. It's my friend, right? So friendship as a way of life then is creating new relationalities that is in a sense outside of biological family. I mean, this has happened to a lot of us queer people. When you have friends who are married, family always comes first. Obviously the husband comes first and friendship is probably a secondary um, once removed to the family, right? um, so when Foucault talks of friendship as a new relational system, a new way of relating, like we use the word queer fam now, right? Why not? Why fam? Why not queer friendship, right? So um, these are new ways of relating that move away from the biological family. Next slide, please. So, as Foucault says, more importantly, that homosexuality is the historic occasion. He says now in the 80s, now that we're here, let us not just make this about sexual pleasure, but let this be a moment in history where we open up affective and relational virtualities, how we relate to each other, right? We're talking about this now in some circles, about aromantic relationships, about friendships that have romance in them, not necessarily sexual, right? To reopen affective and relational virtualities, not so much through the intrinsic qualities of the homosexual. Like I've been saying, like Foucault's been saying, that the way you have sex doesn't make you something necessarily, right? It doesn't make you into a kind of person that oh, you know, these are my intrinsic qualities because of the way I have sex. But because of the slantwise position of the latter, imagine the letter Q, and in relation to the letter O, which is the norm, right? As it were, the diagonal lines he can lay out in the social fabric allow these virtualities to come to light. These new ways of relating to each other that are outside of the biological family, or other ways of relating, where your friend becomes your mother, or your friend becomes your aunt, your favorite. A different friendship as a really, really radical and potent way of creating these new affects and relationalities, right? Relationships, so then he says, relationships between men in war or prison camps. What are some emotional fabrics between people who experience these very intense periods of survival? The possibility of a polymorphic, varied, and individually regulated relationships. Polymorphic, yeah, we were lovers, now we are friends. So something that can morph in many ways. We were husbands, now we are friends. You know, we are brothers. I don't know, right? Uh, where the heart of the relationship is the affection or the emotional fabric, like he says, but it keeps changing. The form of the relationship keeps changing. Next slide, please. Yeah, so we come back to the letter Q, and we think of that slantwise position that he keeps saying, the obliqueness, right? The obliqueness to the norm. That this is the norm, and queerness is a little bit, we look at it like this, right? We think of it in terms of obliqueness. Next slide. The second category, I think I've sent you the JSTOR. It's called Queer Time, the Alternative to Adulting. Now, queer lives, it has been, Jack Halberstam is, where is the, okay. Jack Halberstam is one of the first queer theorists to theorize this in this book titled In a Queer Time and Place, Transgender Bodies and Subcultural Lives. In 2015, actually, adulting became the word of the year. And, you slowly had a critique of adulting. If you think of the heteronormative life, the adult life, it follows a certain logic of time, right? Temporality. When we say temporality, it simply means something to do with time. Now, something very simple, right? I remember talking to my students and young people not being able to get up on time, and says, no, you should wake up early morning. And I remember having this conversation with a friend, and says, you only need to wake up early if you have kids to send to school. And I thought, yeah, that's right. Why do you necessarily need to wake up early? So in a sense, or why do you need to go to work in the morning? We have people who work from home at their own time. So there was a certain logic of time, the way that we organized our time, that followed the logic of family, of heterosexuality, of reproduction. And queer time actually is in opposition to that. And this is what Halberstam says, that it is a willfully eccentric relation. And these are willfully eccentric ways of being that then create alternative relations to time and space. And the idea of a future or a futurity, the idea that you need to have a job at 25, need to get married at 28, need to have a kid by 30. It's just a certain script that life has, and that has to do with, in a sense, the heterosexual mode of life. There's a certain script that it follows, certain logic that it follows. You retire by 65, you buy a home by 30, You have a medical insurance, you have a life insurance, you must have a life insurance, you have a will. So it's almost like your life is scripted in that logic, in that teleological, from A to B, you arrive at B, and then B to C, C to, it's a scripted life. And all futures or futurities are actually defined in times of those points in time. Get married at 25, have a graduation degree by 21, have all of this. It's a very neat script. And what queer idea of time does is it disrupts that straight line of teleology. It says, you know what, I don't follow this logic. And it is also further destabilized by the fact that, and Halberstam says this, that because of the AIDS pandemic in the 80s, 90s, and queer lives being precarious, there is the idea of a diminishing or precarious future that opens up different possibilities of living in the moment, right? It creates a different relationship to time that does not have to do with a very straight idea of looking at futurity, of looking at time. This is something that I'm sure a lot of queer people encountered. Ki budhape mein kaun dekhega? Yeah, you know, who's going to look after you when you're old, because you need to have kids so that there's someone to look after you when you're old. All of these concerns. And what Halberstam asks is, what, so all of this logic of a life insurance, of a will, all of these things that we need to do in time have to do with a certain straightforward logic of reproductive heterosexuality. It is imagined around the biological family. So alternatively, when we think of time, when we think of making communities, not necessarily in relationship to all of this, but in relation to risk, in relation to disease, in relation to infection, in relation to death. What would it mean? What would making communities in relationship to all of these look like? So most importantly, like Halberstam says, queer temporality is about the unscripted life, not ruled by conventions of family, inheritance, and child rearing. Right? So the worry about who's going to inherit your non-existent property, who cares? You know, so the moment you start thinking outside of the family, right, outside of family logic, all of these possibilities start opening up. And you also start rethinking about time and age, for example, rethinking the adult and youth binary, producing alternative temporalities outside the paradigmatic markers of life experience. What are the paradigmatic markers of life experience? Graduate at 21, job at 25, house at 30, first child by 32, second child by 35. All of these are paradigmatic markers that somehow you're a failure if you don't have these in place, right? And queerness or respectability or coming of age narrative, right? All of these actually follow a certain script. If you don't do this by this age, you're somehow a failure, or it is not respectable. Oh, you're 40, but you don't have a life insurance, something like that, right? All of these then follow around the family, a certain scripted life. Please, next slide. So then what you end up doing is you end up pathologizing modes of living. Remember, I'm really, when I talk about the verb queer, I'm really interested in alternative modes of living that move away from reproductive logic, right? That move away from homonormativity, that actually are talking about an alternative mode of life. I am very interested in sexual desire and romantic desire, but for this lecture, for this part of my life, this part of my queer journey, I'm interested in the verb. And the verb for me has to do with friendship, has to do with time, has to do with the idea of happiness. So pathologizing certain modes of living, like I've said, even in the Foucault lecture, the mode of life, right? So pathologizing certain modes of living that show no concern for longevity in the way that we understand it, um, or upholding long periods of stability versus rapid bursts. So people uh, who also are drug addicts, right? Uh, Characterized as immature or dangerous. So Halberstam is looking at all of these possibilities outside the adult notion of time, right? The way that we understand time as a linear with paradigmatic markers, with scripts, that if you are all of these, and if you're outside of this scripted life, you're somehow seen as also queer, right? Um, we also look at time that is ludic, time that is playful, right? Time that has not necessarily obsessed with productivity, but playfulness, that is artistic, right? Um, and so we critique, or we interrogate the idea of the biological clock, because it is centered around reproduction. So you have these different ideas of time called repro time, family time, or the timetable that is governed by an imagined set of children's needs. Like when I began speaking, I said this, right? And obviously, then there is a time of inheritance. If you choose to be outside of reproductive logic, you also move out of generational time. So then there is also time that is dictated by precarious what ifs, right? That of insurance policies. Um, and the schedule of normativity then is not just regulating who you have sex with, but how you organize your time. Um, and I think uh, personally in my own life, I've found this critique of adulting to be a very, very useful category of looking at queerness. Okay. Yeah, so the next slide, please. We come to Sara Ahmed's Unhappy Queers essay. Really one of my favorite essays, because the other category that often queer people have to encounter is that somehow queer people are unhappy. And Sara Ahmed really unpacks this label of unhappiness in three parts. And she says actually that we need to not look away from what we think of as negative emotions, and emotions like shame and emotions like unhappiness, because they have to do with, they're a very important part of queer genealogy. She actually begins that essay by looking at novels that are published in the 1950s and 60s, novels about same-sex love. But the only condition of the publication of those novels was that they couldn't have a happy ending. And Sara Ahmed says that instead of looking at it in terms of only a kind of censoring, it's important to look at unhappiness as an aesthetic category that makes possible the existence of this genre of publication, right? And the idea as if that happy endings would somehow justify queer as being good. And therefore, unhappiness becomes the means, like I just said, as Ahmed says, through which queer fiction can then be published. So it makes possible, rather than we think of unhappiness as a negative category, it also makes possible the existence of a new genre, right? Um, and the need to then resist the binary between happiness and unhappiness literally as indicative of this binary of good and bad, and instead read how this category circulates around the archive of this so-called unhappy endings, and instead look at what it allows one to do. So one of the things that it allows one to do is to read about other people uh, who are queer. Um, so the important question that Ahmed asks is, what would it mean to affirm unhappiness as an important emotion, just like shame, right? It would mean that we have a shared inheritance of a common affect. Um, and then what Ahmed goes on to say, very importantly, is there is a paradox about in this category of the essay called just happiness, where queer parents often tell the queer children when they come out or when they say, I just want you to be happy. And what does this word mean? I just want you to be happy. And she unpacks that. And she goes on to say that often what makes us deeply unhappy is this unhappiness about unhappiness, that I'm happy if you are happy, right? Or that I'm unhappy about the fact that you are unhappy. And all I ever need is I just need you to be happy. And so Ahmed looks at this category of happiness within these speech acts, within these ways of speaking, and looks at, how um, uh, the parent then makes an act of identification with an imagined future of necessary and inevitable unhappiness. Um, and how unhappiness is then like a vicious circle, because um, the queer life is already imagined as an unhappy life, uh, as a life without the things that make you happy, or a life that is depressed because it lacks certain things, a husband, children. Uh, so the category of happiness then sort of becomes a conditional category. Um, and so a lot of queer life is around this conditional category of happiness, that I'm happy, I just want you to be happy, or I'm happy if you are happy. And the judgment of happiness as a category that creates then more unhappiness, right? Because of this conditional happiness. And that the judgment, like I'm saying, of unhappiness then creates unhappiness in the very performance of the failure to recognize the social viability of queer relationships, in its failure to recognize queer love. Uh, and so the Parents' Speech Act, I just want you to be happy, I'm happy if you're happy, creates the unhappiness that is assumed to be the inevitable consequence of the child's decision. So in a sense, Ahmed unpacks this category with strange paradoxes. So she critiques these unhappiness scripts, what she calls as scripts, unhappiness or happiness scripts. Yeah, next one, please. But what Ahmed also looks at, like I said a little while before, is unhappiness as a form of queer kinship, right? What does it mean to be happily queer? And this idea that to be happily queer is to be counted, is to explore the unhappiness of what gets counted as normal. Very, very important essay, in my opinion. Please read it. A critique of happiness scripts, of how happiness in itself is constructed through these speech acts, through these conditional scripts, how in itself it's a vicious cycle, and what gets counted as happiness, right? Is there another slide, please? I think this is, yeah. With that, I think
We would thank Dr. Debolina Deji for such an inspiring and engaging talk. Now, I would like to invite our chair, Professor Vibhuti Patel ji, for her remarks on the session.
Session was,
on your context of unhappiness, can this be related to, to the gender conformity of body image? I mean, ma'am, you're not audible, ma'am.
Hi. So no, I don't think I am theorizing this, Devika. This is something that Sara Ahmed talks about, and this is not to do with dysphoria, or it is not to even by any chance talk about gender identification or the unhappiness about dysphoria. I think that's very central to trans politics and trans movement. No, this is to do with social ideas of happiness or happiness scripts in our life, that somehow happiness has to do with a particular way of being. So it is to do with that. It is not my idea. It's actually Sara Ahmed's essay on happiness, and how happiness or unhappiness can become an aesthetic category and an important category. We don't have to look away from happiness and see it as that unhappiness can also be a productive category. Yeah.
Okay, Vibhuti ma'am, you can go with your remarks.
I think, you have given a very important historical context of the gay and lesbian sexuality and politics, and also profile the genesis of queer theory in the West in the late 20th century. And I think very important, this thing about Foucault's whole history of sexuality, and especially the Bacha Baji, which is still continuing, not only in Arab world, but also in Bollywood. Okay, there are films on it, and child sexual abuse, trafficking. That is also very important reality. My question to you is mainly that currently, like, if you see the recent report by Nazaria POC, and which talks about how the biological family traumatizes and stigmatizes and acts with cruelty and barbarism with their children. Now the term popular in the communities of my students also use, they say chosen family. So what do you think? Is it origin, its origin, is it in India or globally also, this term chosen family is being used? And they are also asking the lawmakers and the state policies also to acknowledge chosen family in all the legal documents.
Thank you for that question. I've thought about this actually a lot, not just, I think about this a lot, about this word queer fam or chosen fam. And I understand the importance of the word family in relation to what we recognize as love or as kinship. Because I don't think when we like someone or and this happens to me as well, I compare them to my father, or I compare them to someone in the family, because I think the family, you cannot ignore the importance of the family, whether it has been a positive experience or a negative experience. The importance of the family as the basis of all kinship around us. Um, and unfortunately, queerness is that part of political life that has to deal with family, whether it's positive or negative, right? Because not because only psychologically, but because our forms of accountability have to do with family, right? If you want a loan, you have to have a guarantor that's family, right? Everything, economic, social accountability has to do with family. So it's really, really important that queer activism talks about the kind of violence that families do, which also then brings out the fact that families are not natural spaces of nurture and love, right? And it's very important to bring that critique out. And activists and advocates have done that. What was very important for me, interestingly, was last year or the year before, when Justice Chandrachud, I think, in a ruling, I think he was giving a ruling
Same-sex
on,
judgment. Same-sex judgment.
and he used the word familial, that he's talking of other live-in relationships, he's talking of adoption, and he used the word familial. Now, again, for me, it's an interesting thing about the difference between the noun and the adjective. Family, when you have to use the word family, you have to have a father or a mother. But when you say the word familial, it doesn't have to be a mother or father or daughter or sister or someone from the biological family. So the word familial is very productive for me, because it stretches, again, the category of the family, which is made up of mostly biological or marriage or family by marriage. For me, what is so it's really important, to answer your question, it's very important to talk about the violence in the family, because the family is not necessarily a naturalized place of refuge for many people, and a lot of queer experience has to do with uh, the violence in family, right? But at the same time, it is a sociological unit that is about economic and sociological accountability. That's where you belong, in a sense. Everything about human sociology is centered around the family. I personally, that's why, move away from, in my personal life, I don't use the word queer fam or chosen fam. I, it's good for people who continue to use that. I think for me personally, friendship is a far more robust category of use, because um, when you're not family, you're not obliged for care, and you're not obliged for certain things, and yet you choose to do it. Um, and it's really important to look outside of relationships that are economic, because I see the family as a legal entity, as an economic entity. When you're bankrupt, somebody from the family, when you need a loan, it's the family. Can you buy a house with someone who's not with the family, right? So for me, what's important is, in my quest to discover love that is different, then I look outside of the label of family. I think it's fine, it's absolutely fine for people who choose to do that. And but my critique of the family comes from the fact that some of the most vulnerable, whether it's women or whether it's siblings who you know they take the brunt of the unit of the family, right? They get subsumed within the unit of the family. And even within, I see, and it is just my experience maybe, of if there are 5 or 6 siblings, it's the queer identified child who ends up taking responsibilities, but also the brunt. So why? Because you don't have a quote unquote family, you don't have a reproductive family. So I think what's important for me in terms of queerness is it creates a new kind of relationality, and that is nothing to do, or that will critique this unit of the family, right? Not a naturalized process of accountability, but other forms of accountability and emotional sort of relating. And that for me is really radical, because that then really tests social and emotional fabrics. So in my life, I don't use the word family consciously. I'm very respectful of people who do, and understand that there are many queer kinship structures that actually substitute the family. Like within friends, they'll call each other Mosi or Mami or Bhabi or whatever, and that's lovely. But I see the dangers of reproducing the family system. I grew up in a big, joint, lovely family, and I was very happy to be a child in it. But I don't know if I would want to be a woman in that family, that big family with lots of women. So I I am very conscious of that contradiction, and I think about that contradiction. That why is it that I was a very happy child in that family, but as a grown-up woman, I wouldn't want to be a part of that family, because I know the people who pay the cost of that family. So I think my relationship with the family is very clear-eyed. So for me, that critique needs to happen because the family also stands on the labor, on the invisibilized labor of many of its.
So do you see it as a mini state?
Absolutely. It has always been like that, isn't it? I mean, it is patriarchy's small cosmos. I mean, yes, and especially in India, I think to do queer politics in India, I was just having this conversation with someone recently, and we were talking of Mahabharata and why Mahabharata is still more of a relevant epic than Ramayana is because, in a sense, Mahabharata is about the Indian family, and it's very difficult to do queer politics in India and not understand how the family functions. You know that you cannot have any accountability here, whether it's a hospital or whether it's you have insurance. All of this have to do with the fact that you have a family. Even if you need a credit card and you're a single woman without either parents, and you don't, there are no guarantors that are biologically accountable. So for me, I think the family as a unit is really important in terms of all of these different threads coming together. And in India especially, to talk of queer politics without talking of the family seems like a little deficient.
I think for whole of Asia.
Yes.
Family values. Mr. Gohil is Pirzada. Yeah.
Yes, ma'am. What a very interesting talk. We just thoroughly enjoyed. Thank you so much, Dr. Debolina. I'm sorry if I pronounced the name
No, that's fine.
correctly. It was such a amazing, very insightful thinking. I just loved the way you narrated the whole thing as well. The concepts given, the time thing that you mentioned was very interesting, and the expectations and the family thing again at the end was just too good. I just wanted to know if you could share the link of Miss Sara, the article that you mentioned. I just
I
want to
have
read
shared
the
all
article.
3 essays, Gohar.
Yeah.
I have. So your
they are shared in the
Okay, great. And then just last one thing, ma'am. If it's possible, I want to just listen to you more. If you've got any podcast or any YouTube channel or any paper that you've written, it'll be lovely. Please do share that as well. Thank you.
Last year's lecture we have on YouTube, you can see Gorge. Gorge is joining from Pakistan.
Hi, Gohar. Lovely to meet you and have
Thank
some
you.
peace
Thank you.
of
Same here.
Pakistan.
I just loved the way you narrated the whole thing and especially the comprehension that you brought into these topics because they're very sensitive topics and things are very similar when you talk about these issues, the family issues between India and Pakistan. So I thoroughly enjoyed the way you communicated. Very sensitive issues, but done as if you were speaking from heart, actually. So thank you so much. And
Thank you.
I'm sorry if I'm repeating, but if you have any other link where we could find more about your writings or things, please do share. Thank you so much.
I'll share.
It's also there in the dossier that we have shared, no? Electron PDF file. You will see all her articles are there in the links.
My friend Shantana is here and she's saying thank you, Shantana, for sitting through the lecture and for attending. So nice to see you here.
We would like
Shantana.
more participants to ask questions, raise their questions in the chat box or in the Q&A box. Yeah, we have Shinoy Panigrahaji.
Yeah.
Hi, Debolina.
Yeah, you can ask your question.
Yeah. Am I audible?
Yes.
Great. Hi, Debolina, and thank you so much for actually like as concisely as possible try to talking about so many views on queer theory. It's particularly hard bringing these in Indian spaces, considering how we view queerness as a colonial academized elite concept. So I am a transgender man, and I don't say this as an identity, but rather as a voice of visibility that trans men are a thing. And one thing I kind of want to ask and also try to understand is, so I was recently reading a book called Side Effects on being trans and feeling bad. And it's also by a trans masculine individual. And there's something they spoke about where, for trans people who have many aspirations for their body, in terms of looking a certain way, feeling a certain way. We've kind of been sold on this idea that, once you do this step, you'll be happy. Once you do this step, you'll be happy. Once you do this step, you'll be happy. And what happens is trans people get stuck in this cycle of constant aspiration and the anxiety of reaching that end point of aspiration, but that aspiration never actually ends because we realize to some extent that no matter what we do, society will not allow that form of assimilation. Like there is this aspiration to assimilate to a large extent. And that kind of it moves into our discourses on surgery. It moves into our discourses on even marriage and family and what we think our families should look like. Very culturally cishet looking spaces, right? And we'll have children. And so it's like, how do we break this cycle of anxiety around aspiration, where, we will do these things and we'll be happy after that. The reality is very different in that sense. Even if I were to do, say, like top surgery, but I may feel a certain way, but now that becomes a part of who I am. And then I tell myself, oh, I'll feel happier if the scars become invisible. And then we constantly keep aspiring to these ideals of the human body and the family and how our relationships will look like. So yeah, essentially that's what I'm kind of trying to understand. Like, how do we break those cycles?
Firstly, thank you so much, Shinai, for sharing that and for asking me that. I'm afraid that what you're asking is not something that I can answer for you, because your trans experience will be different from my experience. But I think what you have more importantly highlighted is something else, which is, I think, we are in a ladder of endless becoming for most of us. I think aspiration, regardless of your identity politics is something that troubles us, I think. I think so I have two other points of references that I would want to bring in here. One is at a time when, trans narratives, I feel, and I might be wrong, in a sense, are already so vulnerable and precarious. I think that while stories like the ones you're pointing out are important, um, it should not become ways of critiquing the trans narratives of um, so I don't want to flatten out, like I said, like somebody asked me about dysphoria and unhappiness, and I said no, because even Judith Butler, when in the 90s, when they came out with their that gender is performative, and Butler has now gone back. A lot of the critique that came was from trans lives. So I think that the trans position is really important to keep as that space, because even during Stonewall riots, a lot of queerness's radical potential has actually comes from transpositions. So this is not to flatten out and say that trans aspirations are like other aspirations, but at the same time, um, I think all of us also are caught up in ideas of acceptability, of validation, of aspiration. And the other thing that I wanted to bring in here was, I think as a queer lesbian person, I've always wanted to talk of violence in intimate lesbian relationships, but it has been difficult because then it ends up pathologizing lesbians even more as whatever violent. And if you look at Kimberly Crenshaw's essay on intersectionality, she talks about the dangers of speaking of violence in Black communities because of precisely this problem, right? It creates a space where you end up stereotyping people, or, um, at the same time, I think if there are trans people whose authentic experiences are like you're talking about, those are important and those should come out. But the other problem I think we face in the context of fluid identities, and that's true of all fluid identities, is that how do we form solidarity? So for me, the verb is important more than noun and adjective, because we are not queer in the same way, we are not trans in the same way, we are not sort of marginalized in the same way. How do we keep alive the balance of difference and sameness, right? How do we create solidarities? What do we do with it? So for me, that's why moving on, the noun has been the least interesting for me. The adjective and the verb are interesting because how do we then move beyond? And at my age, honestly, sexuality is important, but it's the least important of all my queer issues. How do we lead a queer life? So I think for me, what's interesting when I listen to trans people and their narratives is how they lead the lives that they want to lead, whether it is through surgery, whether it is not through surgery, whether it is, and somewhere I think from particular identity politics, and that's why I spoke of identity politics as a historically um, particular thing, right? When did having sex a certain way become a truth about you, right? Because um, so for me, sexuality at this point in my queer journey is not the center of my queer life. It is other things, right? It is being outside a normative family. So for me, what's important is as long as you can lead the life that you imagine for yourself, and then if at at 38, you imagine it certain way, 45, you're not happy. That's also a journey. I think of queerness as a journey and with its own particularities, but more importantly, the material conditions necessary to have the freedom to be on that journey, right? So for me, queerness is having the means to be on that journey as much as that journey. If you are not on that journey, if you want to have top surgery and you cannot have top surgery, then the next part of it will not come to you. So it is also your own journey. It does not have to be a script either. We also have to think outside of the script. So I can't answer that for you, but sure, many times in my journey, I thought it was about love and romance for the longest time in my life. And I realized that while that is very validating, that is not all that it is. There are other things that were more important to me. So you might have the same experience, but that's your experience. That's not an experience that is scripted by common sense or um, more importantly, even homonormativity. I think I'm very, very resisting of homonormativity. And it took me a while to realize that I don't like the noun so much. So these labels, after a point, they start to feel like they prevent fluidity. But fluidity and too much fluidity is, like you were trying to say, is something that we need to think about. And what does it mean to be fluid all the time or at a certain age? So I think these are very important things to think of and think with and problematize. I don't think I have any ready answers. Shantana has her hand raised. Hi, Shantana.
Hi, Debolina. I mean, I've known Debolina, I don't know, for 20 years or something now. I don't know how long. And always from a distance, greatly admired. Her poetry is so amazing. But today I'm completely awed. So, in fact, there were times when I actually laughed out loud when you said that, okay, why do you have to wake up early if you don't have children? I'm like, that is my current dilemma because I have a child and I have to wake up early for next 12 years. And I'm wondering how will I do that? But and also love the whole idea of telos of happiness and how happiness is this great value or why does it have to be this great value, right? Such amazing. I just had one not really a question, but maybe something you can suggest. So you talked a lot about um, relationships between men, gay relationships, and how they have evolved or understandings, etc., but not so much on female relationships, love between women. So I was wondering if you can suggest something that we can read on that, and not only in terms of the sex part, but also in terms of romantic love, affection, friendship, the way you talked about it. So maybe if you have anything to suggest in terms of
So that's actually Foucault who mostly talks about men because he's gay and he's giving this interview in the 1980s. For me, it's either you find academic works on female friendships that have not been that great. For me, what has worked amazingly are actually poets like Sappho, Marilyn Hacker, who's an American poet, and also Black feminists like Audre Lorde, also feminist poets of the 80s, 90s US, Adrienne Rich, who are writing about desire and about other women. Because there are no maps or blueprints about how women have lived with women. Either it is diluted to a form of companionship or it is only been about that kind of desire. So for me, I think the poets really do a lot in terms of telling you how to desire, the strangeness of desire. And yeah, I think the Black feminists and also feminists writing in the 80s and 90s in the US, poets more importantly, are really good places to start from, because they talk, for me, what's interesting right from Sappho, if you draw like some commonalities between the way that women write about their desire for other women, is the language, really, the language in which they do it, and how language comes alive when you're talking of this kind of desire that is not necessarily cannot be boxed, but at the same time, it is about women choosing women for life, all of these women who choose women for life, whether it's Adrienne Rich or Susan Sontag or Audre Lorde, all of these women who lead such beautifully radical lives. At the same time, you have obviously James Baldwin, and um, uh, having conversations in the 80s, um, also caring for each other in their in times of sickness, in times of old age. So really like a language of affection, tenderness, love, friendship, and you can't put them in one or the other box. So really, really good place to start, I would say. The poets, bell hooks, yeah, all of them.
Do we have any more participants?
I think Rimashri Bora has
questions.
Rimashri ji, you can unmute. Girisha Kamboj ji, you're trying to unmute.
Hello, am I audible?
Yeah.
Yes,
Yes.
Facing the Mirror by Ashwini Sukthankar. Yes.
Thank you, Dr. Debolina. I think this is my second time listening to you, and it's amazing. So yeah, I was just commenting about the question someone asked about
Yes.
the experiences of a lesbian love or love between women.
Yes.
So there are not much books or writings, as you have already said many books, you have already referred many books. So I found this particular book very interesting when I was doing my research. So I referred to this book. So I thought I will just share in the comment box.
Thank you, Rimashri. Yes. There's also the Sappho has come out with this book called Monologue. It is bilingual, both in English and Bangla. I think it's very important to highlight bilingual books on queer experiences. Yes, Shinoy, Bell Hooks famously called herself queer page, which is queer, not gay. Very important. Yeah, thanks for that.
Girisha ji, you're trying to unmute. Girisha ji? No? Okay. But quite late. But thank you, Debolina ji, for joining. Okay, no issues, Girisha ji.
I'm glad I could attend the question and answer session.
Yes, I told you it will be good. Good, that is really nice.
Thank you, Dr. Debolina Deji, for your inspiring and engaging talk with us. We hope
Thank
to
you
see
so
you in
much.
further IMPRI events as well.
Thank you for having me, and this was delightful.
Since we are through with all the sessions, I would now like to...
Shinoy has asked a question. I'm going to, Judith Butler's come out with a recent book called Who's Afraid of Gender? That might be, and if you just Google Judith Butler trans critique or something like that, you'll find a lot of material on that.
Right, since this group has so many of researchers, if all the fellows want to come up with a book, maybe perhaps Debolina ji and Vibhuti ji can edit it. We can come up with a edited book if participants would like to contribute. Yeah, because a lot of knowledge and updated references materials also. So we'll reach out to you if you guys plan to, and Vibhuti ma'am, we can plan that.
And please email or anything if you want. My email address is with IMPRI folks. So yeah, more than happy.
Okay,
Thank you,
Vibhuti ma'am, over to you. Closing remarks.
Thank you. Yeah. I think in closing remark, I must say that we all are spellbound. All three experts today, they were extraordinarily energizing, and all of them ended their speeches with the commitment to solidarity. I think that is what is most empowering experience that we had. Now also our trans friends tell us that we can meet in the meetings and seminars and conferences, but we don't get invited to our friends' homes. I think we need to collectively do the self-reflection, that this dichotomy of public, private, and secret, I think that has to be transcended, and that can happen only when there is what we preach or what we try to understand. Also, we bring it in our personal life. I would like to end with verses of Marsha Forrest. Inclusion is future. Inclusion is belonging to one race. Inclusion is basic human rights. Inclusion is struggling to figure out how to live with one another. Inclusion is not something we do a little of, or it is either or not a bandwagon. It is a trend similar to democracy, with liberty and justice for all. All means all, no buts about it. Inclusion is a battle cry, a patient's cry, a child's cry to be welcomed, embraced, cherished, and prized. Inclusion is a kaleidoscope of diversity, bits of color, bits of songs, shapes, sizes. Inclusion is future. Thank you.
Thank you, ma'am. Since we are through with all the sessions, I would now like to proceed with the formal vote of thanks. As we come to the end of day 4 of Beyond Binaries Cohort 2, theme LGBTQIA plus narratives, we are an online international summer school program, a 1-month immersive online certificate training course. I, Ritika Pandey, researcher at IMPRI, Impact and Policy Research Institute, would like to propose the formal vote of thanks on behalf of IMPRI, New Delhi. We are grateful to our experts for the day 4 session, Dr. Debolina Deji, Rituparna Neog ji, Dr. Aqsa Shaikh ji, for taking out their valuable time and allowing us to learn from their online certificate program. We thank our chair, Professor Vibhuti Patel ji, for convening all the sessions. We thank all of our participants who has raised pertinent questions and actively participated in today's deliberation. We look forward to welcoming you next Sunday, that is June 30, for our last day of this certificate course. We are grateful if you are watching us later on YouTube or listening to us on various podcasts or reading our publications. We hope you continue to join in future to our IMPRI Web Policy Talk and Web Policy Learning. Wishing you a good evening. Thank you.
Thank you, Ritika, for moderating the session so well. Thank you. Thank you, Dr.